is. Don't listen to them. It is.
Yeah.
It's what, almost 9:30 in the night for all three of us.
That's fine.
But for you, Ashish, I don't think, because I remember so many days you called me at 1 o'clock your time, in the night.
Yeah.
And you
I can work late in the night, but don't get me up early in the morning. Early morning is a struggle.
Okay, in the next conference, we'll have your session probably at 5 o'clock at your time in the morning.
Morning?
Oh, I think that'd be good. That'd work well.
Yeah, that is going to be fantastic because you will only see that picture behind me. Because I'll turn my camera on and go back to bed.
Just stay up, Ashish.
We did. You and I did for the World Public Health Conference.
Yeah, we did do that. We did do that.
Yeah.
Okay. Now I think audience are coming in. We'll wait for 5 minutes. Then once the session is formally at 9 o'clock sharp Indian timing, Dr. Bhagwati Prasad will start the discussion. Till then, probably.
Bhagwati, the Q&A, how is the Q&A going to be working? Like you will have a chat box for Q&A and then you can questions from the chat box?
Yes, there is a chat box, so I will read out the questions. Access must be accessible to all of us, but I will read out the questions.
Okay, yeah, just you pick and choose whichever you want to ask.
I will do that.
All right, thanks.
It's 9 a.m. Shall we start the session?
Yes, sir. Let us start.
Good morning. It is 9 a.m. in Mumbai, and good evening to the panelists who are all based in US, where it is about 9:30 p.m. So good evening, panelists, and good afternoon to others, depending on where you are. My name is Bhagwati Prasad, and I am going to moderate the session. I hope you and your family members are well and safe. Welcome to the second day of the third international conference on stakeholder well-being through value creation. And this session is on healthcare, and topic of today's session is pandemic-driven changes and challenges in healthcare. I guess as public, as general people, I don't need to say much about the pandemic effect that it has had on all of us. All of us are still dealing with the changes and the challenges that COVID pandemic has brought in our life. Talking about the impact of pandemic on the healthcare sector itself, there are probably several questions in the mind of audience, and I'll just put some questions here so that panelists can address some of these. What is the meaning of value in healthcare sector? Has pandemic accelerated digital transformation in healthcare? Has it made healthcare more patient-centric? Has pandemic decreased inequalities, or it has shown that inequalities exist in healthcare sector? How are the expenditures and investments in healthcare now post the pandemic? What is the impact of pandemic on mental health, wellness, and preventive care? And there are a lot of students in the audience, so maybe on behalf of them, they may be wanting to know what is the future of careers in healthcare sector, what skills they should have to be successful post the pandemic in healthcare sector. To discuss these and many other pandemic-driven changes and challenges in healthcare sector, we have three esteemed panelists with us, and I'm very honored to introduce them. First, we have Dr. Ashish Chandra with us. He is a professor of healthcare administration program at College of Business, University of Houston, Clear Lake, USA. He has served as the faculty chair for the program for 10 years, and previously he has taught at Marshall University in West Virginia and Xavier University in New Orleans, Louisiana. Dr. Chandra is also a healthcare and management consultant. He has published extensively in many journals, such as Hospital Topics, Journal of Medical Marketing, Clinical Research and Regulatory Affairs, Journal of Healthcare Administration, Healthcare Management, and many, many others. He has served as Vice President of MBAA International, President of Association of Collegiate Marketing Educators, and he is on board of the directors of both the Federation of Business Disciplines and the Marketing Management Association. He holds BSc in Statistics, MMS in Marketing, and postgraduate diploma in Computer Science Applications, all three from Banaras Hindu University. He has done MBA and PhD from University of Louisiana at Monroe. Welcome, Dr. Ashish Chandra, and it is a pleasure to have you among us today. Second, we have Dr. Dave Wyant with us. Dr. Dave Wyant is Assistant Professor of Healthcare at Belmont University, USA since 2013. Prior to Belmont University, Dr. Wyant has taught a variety of business and healthcare management courses at University of Minnesota, University of Iowa, Xavier University, and Weber State University. His principal teaching areas are in financial management, healthcare information technology, health economics, and statistics. He has also published extensively in leading healthcare journals, including some of the names: Medical Care, Journal of American Board of Family Medicine, and many, many others. He has a long list. He has obtained his BA degree from the University of Oregon, MA in Economics, International Trade, MBA in Finance from Ohio State University, and PhD in Health Sciences, Health Services, Research Policy, and Administration from University of Minnesota. Welcome, Dr. Dave Wyant, and it is a pleasure to have you among us today. Third panelist we have today is Dr. Gary Ross. Dr. Gary Ross is a clinical associate professor of health informatics and administration at University of Wisconsin at Milwaukee, USA. Dr. Ross has been a professor, lecturer, and instructor, and a seminar facilitator for over 40 years. He has had varied professional career in commercial banking, non-profit leadership, and academia. He has numerous academic publications and remains active in research in healthcare and non-profit management. Dr. Ross was previously the Dean of College of Business at Cardinal Street University and an Associate Professor of Business and Area Dean for Barat College of DePaul University in Chicago. Dr. Ross holds PhD in Business Administration from the University of Kentucky and MBA in Finance and Accounting, MS in Management, and BS in Secondary Education from University of Wisconsin at Madison. Welcome, Dr. Ross. and it is a pleasure to have you with us.
Thank you.
For the plenary session, we'll have about 15 minutes each for the panelists, and in the end, we'll have about 10 minutes for question and answers from the audience. And I request the audience members to put their questions in the Q&A or chat window. We'll first hear from Professor Ashish Chandra, followed by Professor Dave Wyant, and then Professor Gary Rose. We look forward to hearing your views on pandemic-driven changes and challenges in healthcare. I welcome you all once again, and over to you, Dr. Ashish Chandra.
Well, thank you, Dr. Bhagwati Prasad. It's an honor to be back virtually at We Institute. I've been to your institution. You were kind enough to have me over there. When was it? 4 years ago? We were just talking about 4 or 5 years ago. So it is. It was good to see that institutions in India also have a healthcare management program that you are leading over there at We Institute, and you have a very robust program, very well organized and constructed program over there. So that's a good thing over there. From, personal perspective, because when I was growing up over there was nothing like that. But then you also gave me a good list, all the panelists, you gave a list of the questions that we need to address. You need a 1 year long conference for that thing, not an hour-long session. So we will never get done with all those things. So we will try to address it a little bit. All of us will try to address the same issues, let's say in a few minutes. And we may not be able to address all the issues. But one of the things about the thing that you mentioned is value creation. The pandemic did do something new. It actually made people realize what they think is of value very differently than what they thought about it before that. And I will use examples of India itself. Because I have friends like you all over there, and I have family there too. And then I'll talk about people over here too. Very recently, I'm talking last week or so, earlier this week or last week, Rolls-Royce was talking about it, that they had the best sales ever. And they never had that many sales. Rolls-Royce is a luxury brand. And the main reason they said that they had that intense sale is because people started valuing life and the luxuries more than they did before that. Because what for them, life is, suddenly they realize life is unpredictable. Almost everybody who is on this in the audience has been impacted by someone or the other from the pandemic. Someone or the other has died from, pick anybody in the audience, died or has been sick. Oh, forget about the audience. I'm sitting right in front of you. I'm a recovering patient of COVID right now. So I had COVID finally I tested negative on Friday. And today, after 18 days is the first time I was able to leave the house. And that too was for a doctor visit. So if you say that, there you go. Everybody in the audience, you got somebody right now that you know who has been impacted. Value changed for individuals. They started when money used to be considered as the item of value. Not anymore. It's life and the luxuries of life. So when people start valuing these things, which was considered as a luxury item, has opened a new business model for a lot of these businesses. Luxury items, hotels, upscale hotels, which people used to say that now that's only for the people who can afford it and all that thing, who are uber rich and ultra rich and all that thing. Those are the ones who will stay in the luxury hotels. Now common folks like you and I are all staying over there because we started to realize that, you know what, life is short. You make money, if you don't enjoy it, then what's the use of it? When I was growing up, it was a different perspective. It was a different scenario. When Dr. Prasad, when you and I were growing up, at that time, it was like, let's save it and save it and save it over there. But for the kids and all. Now, Gary, you and Dave will not be able to understand what I am going to say, but my friends and colleagues and students and all the attendees, more than likely, most of the attendees would be able to understand what I'm going to say. And this is a phrase which was used in my whole household all the time because we didn't have all the money. So we didn't have the money. That's why. So bear with me. It's in Hindi. It's called poot. No, what poot saput to kyon dhan sanchay. Poot kaput to kyon dhan sanchay. What it means, Dave, Bhagwati, you heard that thing, right? When you were growing up. So Gary, Dave, what it means is that if your child is a very good child, why should I save money for them? Because they will get job and they will make the money. I don't need to give the money. And if my child is not a good child, then why should I give them the money? Why should I save the money for them? So that's pretty much where we are at now, that people have started to realize a few years, I'm talking about 5 years, 6 years ago, the younger generation in India, if you saw them, they had started to really appreciate what they were earning and splurging based on that. That's how the restaurant industry in India grew so rapidly. They started to splurge into different food, into different luxury items, which was not there for us when we were growing up. That has created a new stakeholder for that restaurant business. So from a consumer's perspective, if you look at it, though the pandemic has created new challenges, it has also created new models, new avenues, new businesses. So there is always a silver lining. That's what I will say, that don't take everything as everything is negative. There is always a silver lining over there. So that's one of them. And then from a global perspective, I'll give you that thing in here. I know, Bhagwati, you asked me to talk about future career and options like that. We are the three of us over here, and you included, 4 of us are in healthcare administration. We have seen the role healthcare administration graduates have played in this pandemic. They have been a fantastic asset for every healthcare organization. I am really proud of what my students did over here. My students were in the front lines. They were also, but in the front lines, not directly in patient care. When I talk about the front lines, like devising strategies, coming up with the mass distribution, coming up with protocols, that how can we mitigate some of the challenges, identifying the drug distribution. Even like when the vaccine rollout happened, it's not the doctors who sat down and said, okay, I'm going to pick you and pick you and you. No, it's the health administrators who decided that, okay, let's have this protocol. We'll have this set up over here. This is how we are going to have a flow of the people. I mean, it became a very business model at that time. So the distribution network significantly, the communication model significantly was impacted and benefited by the knowledge and the skills of the healthcare administration graduates. So that's another thing. So there is a lot of potential for your healthcare administration students over there. Though they're not in the front end to take care of direct patient care, they're in the background. They're making sure that all the money is flowing. Let's keep the doctors out of it. Let them really put all their efforts in direct patient care. And let's, on the background over here, make sure that we provide the most efficient and most effective patient care over here. Which, man, I have heard, including my family members in Lucknow, they were standing outside in line just to find a bed in the waiting room, in the emergency ICU room over there, because they were all suffering from patient. So how is a bed opening up? It is sad to say, but people, loved ones were thinking somebody dies, that's the only way a bed opens up. So is that the right way to look at it? That's another aspect. That's when you start thinking about how is the message being communicated. That don't go out in public and say that, oh, wait, we'll find you a bed when one person dies. Let's see who is going to die today. If we cut out their oxygen, that's not the way to do it. So the healthcare, another aspect of healthcare, which is going to be very, very important, is the ethics aspect. How the ethical dimensions of healthcare are going to play a big role in these. And this ethics aspect is directly for the stakeholders. It is a tremendous value that stakeholders look at. If they believe that their care is not ethical, they will diminish the value of that entity just like that. And in healthcare, particularly healthcare sector in India, word of mouth marketing is still the most important form of marketing of healthcare than anything else. So I'm going to shut up over here and let my colleagues jump in over here. So is that good enough, Bhagwati? Should I tag it on to somebody else?
It's okay. And we can hear from Dr. Dev, and then maybe you can come back after hearing from Dr. Gary.
So, okay. I'll let Dave talk and then Gary, and then we can all chime in after that.
Right.
Okay, thank you. It's a big honor, as always, to talk at a conference here. I appreciate very much the opportunity, and I've enjoyed interacting with the folks when we've managed to go to India. In answer to the question, the one question about what's the future for health administration in India, I would say that it's really, really good. And I'd say that on the basis of a concept that economists call income elasticity. Some of you may have studied that when you studied economics, but income elasticity looks at how, as societies, economies grow, how does their spending change? Do they spend a larger share of their money on something or a smaller share? And across the world, throughout time, healthcare has had a really positive income elasticity. So as the United States, as our economy grows, we spend a bigger and bigger and bigger share of our economy on healthcare. So now it's approaching 20%. There's European countries, they range all around, but they'd be maybe around 10%. Other countries with not as much resources are much farther down. So what's going to happen in your careers is not only will India's economy grow, but a bigger percent of that economy will go to healthcare. So I think that should be a very positive thing for you. A second thing that happens is that as healthcare spending grows, the growth in management jobs is faster than the growth in healthcare. And that's happened even with some computerization that we've had, so that we don't have near as many people in some roles as we used to have. It used to be we would have, in America, we would have a room full of people who were putting together bills, taking information together and processing it so that they could have a big stack of paper that they would then mail to the insurance company. Now there's some hospitals where 99% of the time it's totally electronic. The entire bill is just picked off the electronic health record, the registration, and all of that is sent in. And when I talk to a lot of IT type people, CIOs and the like, they tell me that at most hospitals, 75% of the time, they don't reach that 95, 99%. But the other 25%, there's maybe just a few keystrokes to get the bill out. So that's a tremendous change. But despite that, still, the share of the personnel that are in management has continued to increase. All sorts of jobs in healthcare management that didn't used to exist. And as societies grow, more attention is placed on those. One example is patient privacy and security. Most American hospitals now have somebody in charge of that. Disaster planning, discharge planning. A friend of mine's getting his mom out of a hospital, and he's meeting with their discharge planners a couple times a week as they figure that out. when societies don't have that many dollars to spend on healthcare, they don't go to the management kinds of jobs as much. So you should gain from three ways. India's economy growing. I believe India's economy is growing. I've invested a little bit of my pension fund in an India mutual fund. So I hope it grows. But your economy should grow, and that will lead to more spending. But even a bigger share of that spending will go to healthcare, and even a bigger share of that healthcare spending will go to management jobs. So from that standpoint, I think it should be very good for you. With respect to value in general, I was going to comment a little bit. Again, I'm sure some of you have heard of these concepts, but one thing in healthcare is we have both the not-for-profit and the for-profit type of companies. We have the public hospitals and we have the private hospitals. I've been to a large public hospital in Chandigarh and a private hospital in Jaipur and others there. So I know your country is similar to us that way. And people talk about the idea in the for-profit sector that an organization has to have a value proposition. You have to say what you're going to offer the market, or you won't succeed. And so that notion is pretty strong in the strategic planning and marketing ideas. But an interesting corollary has been developed by in the U.S. amongst healthcare managers. A guy named Bruce Vladeck, who used to head up what was then called HCFA, the center, it's now the CMS, the Center of Medicaid and Medicare Services. He came up with what he called Vladeck's Law. And that was a hospital that provides a service to its community will not go under, it will survive. And that was kind of controversial. But as people tracked it, it did seem to be that the hospitals that went out of business in the US were the redundant ones. Way back, we would have hospitals clustered together because one church would create a hospital for its type of people, a Catholic hospital, and then there'd be a Presbyterian and there'd be a Methodist. They still have those names sometimes. And they'd be clustered together so that the doctors could easily get from one to the other. And then if you belong to the Methodist church, you could get your minister to put you in the Methodist hospital. And so then when time progressed, they found that that was really inefficient to have all these hospitals together, because after a while, it didn't really matter what church you went to. And so those were the hospitals that went under, was the redundant ones that were across the street from each other. The ones that were the sole community hospitals tended to stay open. Not quite so true anymore. There's quite a few smaller ones that are going under. But Vladeck's Law has also been looked at. There was a saying about not-for-profits that went, no margin, no mission, which meant if you didn't make a profit, you weren't going to stay in business. And Vladeck's Law flipped that. Vladeck's Law said, no mission, no margin. In other words, if you don't have something, a mission that your community finds of interest, then you're not gonna be around for very long. So we can kind of see a parallel there between the idea of a value proposition for the for-profits and the no mission, no margin for the not-for-profits. And with that, I'll turn it over to Gary.
Thank you, Dave. Over to you, Gary.
Thank you very much. I want to also thank you for giving me the opportunity to be involved with this plenary session today. I want to thank my friends Ashish and David for being part of this with me. I'm going to take a little bit different tack on what I have seen the effects of the pandemic a lot of the work that I do has a tendency to be on an organizational level or a community level, a little bit broader level than the individual or micros. And I've been very involved in teaching these classes that are asking these questions, and what did the pandemic do in the United States primarily, but also around the world, and how it changed a lot of the ways that business was being done, um, in new industries that popped up or new sub-industries that popped up. What we're doing right now has really been a result of a lot of the technology advances that were absolutely demanded of the medical profession, to be able to speak and talk about things like this, and so that you could talk to your colleagues around the world at a moment's notice, and rather than just on a telephone, but through the wonders of Zoom. It's still a miracle to me how this happened. I'm a child of connected telephones, and I can even remember my grandmother being on a party line, which many of you out there in the audience don't have any idea of what it was. It was some of the greatest entertainment in the United States that ever happened, and that people would have be able to listen in on other people's phone conversations, depending on what the ring was. But the other thing that I was uh, have been intrigued with is the change in how business works now. It doesn't necessarily fit the model anymore. And the model being, you showed up for work at 9 in the morning or 8 in the morning, and you'd go home at 5 at night, and you'd go back to your house. Well, now in what we can see is people are becoming more demanding of being flexible. So many people were, once the economy started to get back on the trails after the first 6 weeks of the pandemic, they were working at home and they became comfortable with working at home. There are some of my colleagues who have not, I think, worn anything but pajamas for the last 2 years or so, because they've been working out of their house. They're very happy with it. And it's something that not only the health professions, but the people that they serve are experiencing different types of work experiences and are working at home. A lot of them are using the new communication models that we just talked about. The meetings, I think I just heard the phrase that we're having Zoom fatigue, because we're doing this so often rather than actually seeing people face to face. We're social animals, and there are some studies that are being conducted in the U.S. now about people are actually lonely again, because they're not connecting with their colleagues on a face-to-face basis. Another thing that happened that I think is fairly interesting, and it's one that we're all aware of it, but we've kind of been blinded in certain times to it, is the other factors that influence the employees in healthcare that we really almost ignored. And the biggest one is mental health. I think that the mental health aspect of the effects of the pandemic on people in the healthcare industry especially has been very, very impactful. You are seeing a different type of management model being developed by many medical institutions that are taking the mental health of their employees in the concern about it in a greater part of what they do for the employees, which I think has been one that we've always known it, but it's been kind of silent. We know that the medical profession, especially the provider side, has always had a high level of stress, but it's not the stress that has come through and the mental impacts on our providers, and also the people that work in hospital administration, has been very, very severe. I had a conversation with a nurse that had been an ICU nurse, had gone back into the clinics, and was re-recruited into ICU. And she said, the absolute worst thing is we all know that people die, but not to the degree that they have been experiencing those deaths. You would go in, and she said for a couple of weeks, all we did was watch people die. And there was nothing we could do about it. And you can only imagine the degree of an impact of stress and having to come in every day and deal with those type of things. And it's spread out pretty well across the entire medical profession, that we couldn't do anything. I think that's probably one of the most difficult things for medical professionals to deal with. Is for a good period of time, we were doing triage, we were doing band-aids, we were doing patchwork, but we really didn't know what was going to work and what wasn't. Now with vaccines and our experience, and we do know a little bit more, but still, we were talking before the conference about how many people have died. The United States, we went over 7 million deaths from the pandemic. And each one of those deaths has an impact on the employees and also the families and also the administration of the hospitals. One of the things that I've talked to my students about, because it's a very hot topic and it's a very hot job category in health administration, is supply chain. I dare say that 5% of the population in the United States, and I have no idea what it is in India or the rest of the world, even knew what supply chain was until we started to talk about it. And not only because of the economic impacts that it's had in a larger view, but in hospitals, working the supply chain and being able to produce or have be able to obtain items. I think the first thing was that we weren't able to get gowns, we weren't able to get gloves, there were some professionals that were using the same N95 mask for weeks at a time because they couldn't get what they needed. And now that is eased off a little bit, but people understand now that these things just don't appear. And I even think some hospital managers were unintentionally caught off guard on this. But the one thing that, and I talked about this with my class today, that I shared with them a memo that was written by the World Health Organization in the spring of 2019. And what they did is they outlined the 10 most important or potential problems that were facing the world at that point in time. And the number one was just the lack of access and the lack of ability for people to get healthcare. And again, this was pre-pandemic. But the number three was they were most worried about a pandemic. And the reason is they said, we're not prepared. We are literally not prepared. We don't have enough connections internationally. We don't play well together. We are constantly at each other about what works best and what didn't. And one of the things that occurred from this, and I was thinking about this because of we have in India and has a developed healthcare system. The United States has a wonderfully developed healthcare system. Canada, the Europeans, the disparities between healthcare systems in what I will call the haves and the have-nots, I think has been exacerbated by the pandemic. And it's going to prove to be one of our biggest challenges as we come out of that, because this isn't going to go away in a ubiquitous manner. There are going to be a lot of countries and a lot of places that are still going to be struggling with this. And the questions getting down to some of the things that Dr. Chandra talked about in the ethics of healthcare. Who's going to get what? Who's going to get the help? Who's going to give them the help? Are we going to be willing to share what we have, or are we going to hold it tightly? And that disparity in healthcare, as I'm teaching a comparative health systems course right now, is something that I want the students to see, because they've got to realize that the world is dependent on the other parts out there. And if we don't do what we need to do to reduce these disparities rather than allow them to exacerbate, I think that's going to be one of the longer lasting effects of the this pandemic. We know that there's always the possibility of new ones being out there, and it's just going to be interesting to see how this does play out in the world, and how we start to collaborate better overall. I'll punt. It's back to you, Dr. Prasad.
Thank you, Gary, for sharing your views. And I request audience to put their questions in chat window, and maybe I can ask one question to each of the panelists, and they can add any other thing that they want to add after hearing other panelists. So maybe to Dr. Ashish Chandra, I want to ask you once again, what is the state of digital transformation, because your background in computers and IT? So, and is telemedicine, for example, here to stay? And anything else you want to add?
I've been talking about telemedicine for what, 25 years now? When I was talking about telemedicine, nobody even knew what I was talking about. So, but telemedicine is going to stick. In fact, it is going to transform also. What you will find that in telemedicine, the way we look at it right now, that there has to be somebody on the other side who will be evaluating and making an assessment. It will become a lot more in future. If I were to make a prediction, I'm going to predict that the individual will be asked to enter a few things, or even by verbal command and all that thing, that how are you feeling? I'm not feeling well. What's your fever? Or there will be the cameras which will just sense what your temperature is, all that. And it will be an auto-generated medical, basically diagnosis, with no healthcare professional sitting on the other side. So if I were going to make a prediction, that's what I would be predicting will be happening. So does that make the healthcare professional obsolete? Well, every profession will have to improvise. So, I mean, doctors should not assume that their jobs are absolutely secure. And like Gary Ross was just talking about, that the high level of burnout in the next, I'm not talking 10 years down the road. I am just talking about 2 years down the road. Don't be surprised that a whole bunch of nurses and doctors, they just quit, or they just took a 1-year sabbatical. If that happens, then suddenly you have created a very high artificial, let's say, a shortage of personnel, because they just got burned out and you never listened to them. You should listen to them. Employers should listen to their employees everywhere, even in India, that if an employee is saying they're showing symptoms or they need a break, then their body saying that they need a break, you better give them a break or you will break them down, kind of deal. So that you may lose the employee completely. And by that, I'm talking even loss of life. This disease is very different from anything else. And this disease gives you a lot of warnings. And for example, last week, my body just said that, nope. And I got up, have breakfast, and I just went to bed, and I was inside the cover all day long. And that I was talking to my doctor today. I had my visit. And you know, when a doctor calls you, it's like going to the principal's office. You don't know what I did wrong today. I'm just going to be yelled at anyway. So my doctor was just telling me the exact same thing, that your body is telling you to quit. You quit because if you don't, your recovery time is going to be extended. So if my recovery time is going to be extended as an employee, I am worthless to my employer, or I'm not bringing the same value back to the employer. So the employers will have to be a little bit more compassionate over here, and they need to learn that what are some of the challenges that the employees are facing. So that's my perspective about IT and all that going in. Hopefully, and I know Dr. Wyans talked about the EMRs and robotics, and they're walking around and making decisions and all that thing in front of pharmacies, and a lot of robotic pharmacies are popping up over there all over the place. But that's one thing I will talk about. I'll say is, if I were going to make a prediction, you will be doing virtual visits with Dr. Google.
Yeah, I think Ashish is right on that. It's kind of one of the things that was kind of a watershed in America is Medicare decided to pay the same amount for the virtual visits as the non-virtual, the old-fashioned ones, and that really changed that. And everybody I talk to says we're not ever going to go back. We're not going to go back to where there's a two-pay price system. One interesting thing that's happening in America that's kind of cutting edge, but has some barriers to it is there's been a long period where we've been trying to get interoperability where we can share things across different IT platforms a lot better. And a recent law has said that all providers need to have the capability to use a messaging system called FHIR that would allow their data to be transported to mobile devices. So if somebody walks into their facility and says, I've got this device that can receive information from that messaging system, they have to be able to pass the data. And some people feel that that's going to be a really revolutionary change in the ability for patients to be more monitoring their data, and also for the data to go back to the providers. We'll see on that. That's what the HIMSS group calls foundational interoperability, the ability to move data back and forth. But there's still other barriers with it. There's the barrier that there's different types of databases, for example. Some people use tables and other people use trees for their data, and you can't really move data from a table to a tree very easily, although they may come up with software that does that. And there's also problems with the way variables are defined. So one person might call something a exploratory test, and somebody else might call it a diagnostic test. So they need work there. And there's also interoperability issues that they refer to as organizational barriers. Sometimes there's some law or something that will prevent you from passing data. But the use of moving data back and forth from providers to people and people to providers may really expand. There's some things now that can be monitored on, say, a wrist or something, but that may be the next thing, maybe. I wouldn't predict it because it's got those other barriers, but I don't know, maybe Gary has some feeling.
Well, one of the things that I think would be you would have some people out there that would say our ideal is if we made doctors obsolete, that artificial intelligence would be taking over, just reading what was there, and we wouldn't need to have that third person there, and then we'd be able to cut the expense of a doctor out. I kind of laugh at that. It's science fiction. But one of the things that we do know, and this is a pretty universal set of knowledge, that about 85 to 90% of everything that happens with the human being, we know why it happens and what the diagnostics are, what the symptoms are, and how to take care of it. There are more simple situations, and they're ones that's the reason that you're seeing in the healthcare system provider side a bigger growth in advanced practice nurses and physician's assistants. because they are able to exercise judgment that is really monitored more by the big data side of we know what happens. That other 10% is what I like to call the reason that doctors went to doctor school. They can be doctors rather than having to say, take 2 aspirin and go home and go to sleep and use their valuable time. There's going to be a shift in the way that time is being used. And that's part of technology, is being able to do that. They're going to help medical systems utilize the times of their physicians in a much more efficient manner than they have in the past. We've already seen some of the changes that have gone on in that. But one thing I wanted to, I thought I saw a question about how is IT changed or it's changed in its role. Information technology 20 years ago was really more of an item changer or item chaser. They set up internal records. They passed in or created information out of the data that they had in there, but it was fairly rudimentary, and it was more of just a straight information provider service. Now, with the changes in the way work environments are set up, this thing that I talked about before, the amalgamation of data, it's become more of a communication system. Its role has expanded. The roles of the IT professionals in not just hospitals, but overall has changed rather dramatically. Part of it has to do with what we're doing right now in the way that we communicate with each other. But it's more of the communication demands that we have, that IT is not only changing, but also gaining in power and prestige within the organization, where the idea that you had a chief information officer or a chief technology officer within a system is something that if we would have bounced that off of our colleagues 20 years ago, they would have say, what are you talking about? But it's just the need for a different type of communication, a different type of system, and also the cross-industry information that needs to be changed simply because of the way certain things are taken care of. I think that's probably what I see as looking at organizational dynamics. It's going to be interesting to see how it continues to go forward.
We have another 10 minutes, so maybe I can come to Dave, and he talked about income elasticity. So I just wanted to ask, like, a lot of treatments have been postponed due to this pandemic. So any models have been created about what is likely to happen? Suddenly there's going to be a lot of demand for pending, voluntary treatments or surgery, etc. Dave, and then others can pitch it.
Okay, there is a lot going on with that. There's a lot of things being written about what's going on with that and how things have been disrupted. A lot of people are looking at things like, say, mammograms, and they're expecting there's going to be a big wave of people who come back and use those things more. There's a lot of stories about studies that have looked at postponed healthcare for some things, maybe that have led to mortality. People maybe didn't come in soon enough to get something done, and it caused bad side effects. And it's been really lopsided in that some professions didn't have any work because the hospitals were loaded with COVID people. I would imagine it's the same way in India. I haven't read those stories about India, but so for some specialties that it wasn't considered to be life-threatening, the people were told postpone that. So I don't know of particular models that have looked at that much, but but there does seem to be a general expectation that there's going to be a wave of people coming in, particularly in some specialties. It was interesting along that line. For decades, people talked about if we ever had a major healthcare system change, like we ended up having it with Obamacare. They were talking about we might have people who they were described as train wrecks come in who had never had insurance for decades and then get a lot of care. And that did seem to happen a little bit with the after Obamacare got passed, hospitalization rates went up, which again, that's another kind of elasticity. That's price elasticity. That's when the price changes, do people get more care? And that the big study on that a few decades back was a RAND study. That if anybody's interested in that, the lead author was Will Manning on that. But I've used that in some budgeting things where if people go from having paid for care to free care in the United States, a large group of people do that, then for every 2 visits they did go to the doctor, they'll go for 3. So there is a bump from just getting better insurance coverage. But yeah, I don't know any specific models, but we do anticipate a wave, particularly in some kinds of specialties.
Thank you, Dave. There is a question, maybe I can pose that to Gary, and the question is, has AI in healthcare got some traction? And maybe I can expand this. What type of collaborations are taking place? Maybe if you can add to this particular question in healthcare, whether hospitals are collaborating with, let's say, pharma is collaborating with insurance, and so on. Gary.
Maybe I'm just a little bit older than a lot of people, but AI scares me because it's too deterministic. And in some cases, AI is fine. It's that 85 to 90%, I think, does a lot to take some of some of the pressure off of the medical profession. But I think there's always going to be a need for the individual within this. It's just that it's the most complicated machine in the world is the human being. And you need to, create a phrase. You need, I'm sorry, one of my cats got downstairs and is bothering me here a little bit. You need that medical engineer. You need that skilled physician to be in place and maybe be able to interpret things that AI simply is never going to be able to do. One of the things that this just happened in the US, and it's totally off the subject, but I threw it out to my class today. There was a young man somewhere in the US, and this is true, was scheduled for a heart transplant. And he was in his 30s. And he was refused the heart transplant because he came into the hospital with COVID and he was unvaccinated. And the person who was in charge of the transplant area had to make that decision not to give him his heart. And he has 2 small children. So this is where the ethics part of it comes in, that Ashish touched on and David just touched on, that I throw that one out in your classes and say, should they give him the heart, even though it wouldn't be as long of a functional improvement for him, other than, or potentially give it to someone who would live longer with it. That I think is the big thing that when David talked about Obamacare, that was one of the big discussions is, would care be rationed in the United States? If we start to control our costs too much, would care be rationed in the United States? So that's another discussion. But from an ethics standpoint, I think these are some of the things that are starting to occur because of the pandemic. But AI, I would very much love to see it to the point where a lot of the things that we now have the knowledge because we've become smarter, we've become better researchers. If we could have the data that would be as good as it possibly could be, to have a role in everybody's healthcare. I think it just it's from a cost standpoint, it's probably as wise a move as we could possibly have.
Thank you, Gary. We have one question. Maybe I can take this to Dr. Ashish Chandra, and then maybe we'll close the session. The question is how difficult it was for hospitals in US to manage supply problems and shift bottlenecks continuously in such dire circumstances of the pandemic. So Ashish, and then we'll close the session. Any other final thoughts as well you can share?
Well, it's a loaded question. That's the way I can say this question. There is no right answer for that thing because the pandemic created an issue for the hospitals, which they had not anticipated. Here's how hospitals work. Most of the hospitals have a small ICU unit, and the ICU units are over there for patients to be there for a very short duration. And after that, they go to a recovery room, the private room and all that, but then they're out of the hospital. What the pandemic did, and this is where nobody could have made this prediction. So I don't blame anybody on this thing worldwide. Nobody could have predicted that patients were coming in the ICU rooms, but they were not dying and they were not leaving. They were occupying that ICU bed for a much longer duration. So even though they may have hospital beds available in the hospital, it's the ICU beds where the challenges started happening. Every time, that's why somebody mentioned earlier on about the elective surgeries and what surgeries are going to be controlled and not performed. Well, every time you do an elective surgery, the first thing you do is after surgery, they go for a short stint in the ICU bed. You don't have it. Where do you send them? And that is a big challenge over there. And I'm not till the pandemic has started to wind down, let's call it, till we get people vaccinated and all that. And realistically, it will take months, if not years, to get everybody vaccinated. Just logically not possible to get the vaccine distributed. So unless until you get everybody vaccinated, and there are lots of people who have different beliefs of why they should not be get vaccinated. Now, I've heard all kinds of stories that there is a microchip in there. And if you have these rumors going around in India as well, that, the microchips will make people follow in the government. I don't want the government following me with the microchip. The government is already following you, okay? It is called this device that you have in your hand, which you cannot live without. A phone. Your privacy is not private if you think. So, there are all kinds of stories I've heard about microchips and following and brain alteration and all that thing. They'll get in my bank account and all that thing. I wish they did. Somebody will put some money in mine. So when they see what I got over there. But that's what I will say. The bottleneck, till you start getting a handle over the number of people coming in with COVID over there, till that is shrunk, the bottleneck is still going to be there. Gary, Dave?
Yeah, I agree. And it's one of the other things that happened is that a lot of hospitals were turning normal beds, normal rooms into ICUs. And it was depressing the ability to have a census in the hospitals. But again, as she said, until we can get a handle on that, it's just, it's going to still have a depressing effect on the performance of most medical facilities worldwide. And we're getting better. We know more what to do, but it's still going to be a very, very difficult transition back to, if we ever go back to normalcy.
Thank you very much, Gary and Dr. Ashish, Dr. Dev. We are nearly the end of the session. So thank you very much for your insightful views. I'm sure students, researchers, faculty, colleagues have benefited from this discussion. I'll just quickly summarize a few points from the discussion because we are running out of time. So Dr. Ashish said that we realize in the pandemic, life is precious. And from a student's point of view, there are a lot of jobs that are waiting to be taken. He also talked that virtual visits will remain permanent and they'll become, they will need them continuously. Dr. Dev talked about income elasticity, and as expenditures in healthcare in India will increase, again, management jobs will increase for students as well. He also talked about no mission, no margin concept. Dr. Gary talked about, once again, jobs in supply chain management are likely to increase due to COVID and pandemic. And he talked about the pandemic related mental health issues and need of wellness. He also emphasized the need of ethics in healthcare a couple of times. Thank you very much for this wonderful session. And it was learning experience for me and my audience as well. Thank you very much. Over to Professor Murthy, if there is anything else here. Maybe all the panelists can turn on our videos and we can take a group photograph.
I know you're not Dr. Murthy.
Yes, I'm not Dr. Murthy. Just hold on for 1 minute.
Sorry, Ashish.
Are you changed, Murthy? I saw you in you. You look different.
No, I was in the opposite table, and thank you. It was a great session. Actually, we had a this thing, a large television with that audio on, and I was sitting there in front of the television watching the discussions. It was fantastic, and thank you, Professor Gary. And Professor Dave, I don't even thank Ashish because I believe he's part of us. Thank you very much for staying awake so late in the night and helping us to carry out this discussion. And we definitely look forward for the further discussions and further inputs from you, and we'll be in touch with you. And thank you very much for this great session.
Another session is at 10.
And,
thank you.
Yeah, thank you. And the attendees, now it is a tea break for 15 minutes and 5 minutes. I'm sorry, 5 minutes, and let us join back for the next session. Thank you very much, Professor Gary.
Thanks for having us.
Ashish,
Thank you.
Professor Dave, and Bhagwati Prasad for nicely navigating the session. Thank you very much.
Thank you.
Thank you all. Goodbye.
Yeah, let us meet after 5 minutes.
Please keep the door open. Hi.
Good morning, sir.
Hi, good morning.
How are you, sir?
Good, good. Thank you.
Thank you for accepting our invitation, sir.
No, my pleasure. Thank you.
Sir, within 2 minutes, we'll start the session. We have close to 500 participants for the conference, and we are just broadcasting this session on the YouTube. Namaste, it's 10:15 now. We can start the session. Welcome to We School, sir, and thank you for our accepting our invitation and gracing this 2 days international conference. It's my pleasure to introduce the eminent speaker, Sri Ramanan Ramanathan, sir. He is a former mission director at Atal Innovation Mission and former additional secretary at Niti Aayog, Government of India. Ramanan sir has served as a first mission director at Atal Innovation Mission and a former additional secretary at Niti Aayog, formerly called a National Institution for Transforming India between June 2017 to May 2021. It is a flagship national innovation and entrepreneurship initiative launched by Prime Minister's Office, Government of India. As the mission director of AIM, Ramanan sir has been instrumental in the launch and the execution of several nationwide innovation and entrepreneurship initiative, which is resulting into 10,000 plus Atal Tinkering Labs being established in the schools. Nationwide, with 8,700 plus are currently operation in 650 districts and 4 million students having access to the innovative technologies like 3D printers, robotics, IoT, electronics, and do-to-yourself kits. 75 plus Atal incubation centers selected with 68 plus operational in the universities, an industry with 2,050 plus startups and 640 plus women-led startups, with 20 Atal community innovation centers being established in Tier 2 and Tier 3 cities in rural India. 56 Atal New India Arise, that is applied research and innovation for small enterprises. The challenge winners selected, in creating Make in India product, service innovation with the ministries of India. And sir, you were very instrumental and took the personal initiative in establishing this innovation culture in India. Thank you so much, sir. Dr. Ramanan sir has previously managing director and CEO of CMC Limited. He joined TCS in 1981, graduating from IIT Mumbai in electrical engineering, and played an instrumental role in the growth of TCS. He is an Harvard Business School alumni, HBS AMP 187, recognized in sustainability leadership by Cambridge University, and has an honorary doctorate by the Gujarat Law University. Ramanan sir has awarded 2019 National Digitalized by the Year by SAP Mint and 2020 Outstanding National Public Service Award by Confederation of MSME. He received Most Valuable CEO Award from Business World India twice in a row. Asia's Outstanding CEO Award and from the CMO Asia, Singapore, Rajiv Gandhi Shiromani and Indira Gandhi Sadbhavana Award. Ramanan sir is a lifetime chair of Harvard Business School's AMP 187, board member of Israel India Innovation Forum, E-Samiksha, Unnati Government of India Initiative, chair of New Zealand Trade Enterprises, board member of Indo-US Technology Trend Forums, Indo-US AI Committee, and former member of Tata Group Innovation Forum. We are very lucky to have you, sir, at our conference, and we School Innovation Cell. At Innovation Cell, we are so far doing good. And in the initial days, you guided us, supported us at Niti Aayog in our personal visits. Thank you so much, sir, for guiding us throughout, and over to you.
Thank you, Dr. Vaishali, for that very generous introduction. Good morning to everybody who is logged on to this call, the various faculty members, the management of Wellington Institute, the young budding innovative students who are all eager to make their impact, or as the great Steve Jobs said, to leave a ding in the universe. And I'm sure every one of you is wanting to leave a ding in the universe, an impact that resonates across the world, not only for yourselves, but also for the society, for the country at large, and for the world at large. Also, before I proceed, even though it is not too late, it is still January, so a very, very happy New Year to all of you and your families. And this has also been the Republic Day week, so happy Republic Day to everyone. We are indeed living in unprecedented times. A simple virus has paralyzed countries across the world. It has created grievous disruption to supply chains across the world. It has created national lockdowns under whose effect we are all still reeling. It has disrupted life and livelihoods for many people, displacing them from their normal place of work, caused migration, which has created tremendous problems for many people in our country, in a country like India. And more importantly, it has created a fear of uncertainty of what the future holds for us. What about other pandemics lurking in the horizon? What about issues like climate change that we have been talking about and hearing about, but we have not yet faced its full ferocity as we have in this pandemic? What about issues related to the Sustainable Development Goals that the United Nations has rightly brought to the attention of various countries? The 17 Sustainable Development Goals, which include elimination of poverty, ensuring water, ensuring waste management, ensuring livelihoods, and so on. These are all the various challenges that are there in front of us. But at the same time, I would like to bring to your attention, my dear young students who are out there, nowhere in the history of our civilization has the time been so opportune, has there been such a right environment for every one of you to be able to solve these thousands of problems or millions of problems through your innovation, through your creativity, through your entrepreneurship. And that is why this subject, which has been given today, and which is the theme of this particular event by the Wellington Institute of Management, and rightly so, the world of startups, the world of innovation, the world of entrepreneurship. Why does it make such an important aspect of every student's life? You see, when I was graduating, and while Dr. Vaishali was narrating the various institutions that I attended, I'm very proud to have also attended Ramnarayan Ruya College, where I got inducted into science and technology, and from where my journey into IIT and the rest of my journey started. So I want to thank my alma mater for inducting me in an exciting world, a world that I have ever been impressed because it has continued to grow during my own lifetime, but it's going to accelerate further in your lifetimes. Now, what is the opportunity in front of us? You see, we are living under three very, very important conditions in India today. And therefore, my dear young students, this is your watershed moment. This is the moment that you have to seize and become a startup creator, an innovator, a job creator of the future. And let me explain to you why. We are a country of 1.3 billion plus people, but we enjoy what they call as a demographic dividend, which is the envy of many a country. We have more than 65% of our country under 35 years old. We have more than 50% of our country under 25 years old. So we have what they call as a demographic dividend, which is the envy of many a country. And when you have this demographic dividend, this youthful energy coursing through the nation, you are a young set of people who will find peers who are able to contribute with their energy, their enthusiasm to your ideas and be able to create an impact on the world. The great Steve Jobs said, as I began, let us all leave a ding in the universe. Now, what does leaving a ding in the universe mean? It means that through your contribution, through your innovation, you are going to leave an impact upon others. And that is what we all need to do and can do with this first big advantage that we have, which is called the demographic dividend. The second is we are one of the fastest growing economies of the world. We have been growing at 6 to 8% every year, barring the COVID-19 crisis. All the indications today are that we are going to be growing between 8 to 12% in the coming years. Now, for a country of our size, which is already one of the fastest growing economies of the world, this sort of growth is unprecedented. And this sort of growth is required for us to be able to stimulate innovation and create that ecosystem where thousands of entrepreneurs and thousands of startups will not only survive, but thrive and create an impact. So we have a fast growing economy. The third is we are living in a world where technology is changing the very shape of the world that we all are living in. Technology is changing the way you are experiencing the world and the way the world is experiencing you. As a result, today, even during the COVID-19 crisis, and let me tell you, if this crisis had struck us 10 years ago or 15 years ago, we would be in terrible shape. But because of the advancement of technology, because of the advancement of digitalization, because of the fact that technology has become accessible, affordable, available, and advanced, because all these technologies are within our reach, and because the world has become a smaller place due to digital transformations, but an increasingly more connected place, we are in that great position to be able to leverage this technology, which is now available in India and affordable in India, to reimagine the new world of tomorrow. So you, my dear young students, are in a very fortunate situation. When I was graduating from IIT, or when I was graduating from RUIA, or even when I was entering into work, we never talked about the word innovation. The word innovation was not a buzzword as it is today. We didn't talk about entrepreneurship because it was too risky for us to be able to think about becoming an entrepreneur. All of us wanted to just become job seekers in the first possible job placement opportunity that we got in a large company. We became a nation of job seekers. Our education system, which was primarily based on rote learning and getting advanced degrees and getting certificates, were tuned towards us finding the job that we wanted. And it served us well. Out of this education system that we have today 1.4 million schools in our country. We have over 10,500 engineering and related institutions. We have over 39,000 colleges, and we have over 150 million young students like you entering into the workplace over the next 5 to 10 years. We have created $190 billion plus or a $200 billion plus ITES industry. We have come to be known and respected and be regarded as the country which is going to be an integral part of the knowledge economy that is sweeping the world of tomorrow. We have, in a way, established ourselves in the international market. And look at it. We have a Satya Nadella heading Microsoft, a Sundar Pichai heading Google, a Shantanu Narayan heading Adobe, a Chandra heading Tata's. We have an Arvind Krishna heading IBM, or we have a Parag heading Twitter. These are all global world-class companies. These are all companies upon which everyone in the world is dependent on for their technology needs. And from these, all these people have risen to the highest potential, and they are Indians. So India has never lacked for great innovators, great engineers, great scientists, great doctors, great teachers, great academicians, or great artists, or great writers. We have never lacked for them. But what we have lacked so far was that ecosystem that enabled everyone to reach their full potential. That, my dear young students, when it was made available to all of these people I talked about in the US or in other economies, they were able to flower and blossom to their full potential. That is the ecosystem that is being created in India today, not only being created, it exists in India today for you to avail of. So we are going to have 1,000 Abdul Kalams springing from the remotest parts of our country, irrespective of where you are based. After all, an Abdul Kalam came from where? He came from a small, humble town of Rameshwaram, a town in the coastal districts of India, a town many of you people would not even have visited or don't even know exactly where it is. But it is a town known for maybe a few schools, 1 or 2 universities. It is known for its hundreds of temples and thousands of fishing boats. And from such a small, humble town came one of the finest scientists India has ever seen. He got to be known as a missile scientist. But sitting down in those fishing boat, he dreamt big. In his book, Ignite, he says, dream big and you will achieve great things. Dream small and you will be limited by your own dreams. And my dear young students, he sitting down in the fishing boats of Rameshwaram, dreamt big. He wanted to become a pilot. He didn't become a pilot, but he rose on to become one of the finest scientists who launched huge satellites across into space. He rose on to become the president of our country. Similarly, there are countless stories of our people coming from our tier 2, tier 3 cities and rising to the highest level of eminence that they can be allowed to reach. When they came from those small towns where they did not have at that time the ecosystem to support innovation and entrepreneurship, and they were able to achieve so many things, you, my dear students, can achieve much, much more. Because today you are having that ecosystem that is spurring innovation, that is spurring startups, that is spurring new job creation. We all want to become a nation of job creators, not just job seekers. And you, my dear students, who are having this advantage of studying in a prestigious institution like Wellington and all the schools that you attended, you have the ability and you should become an entrepreneur of the future. It is not that I expect that everyone starts a startup, but you have to have an entrepreneur's mindset. Even if you join any company today, if you have an entrepreneurial mindset, an innovative problem-solving mindset, a mindset which is not regulated by, I will just do what somebody is asking me to do, but I will innovate. I will do better than what somebody is asking me to do. I will question. I will look at the problems in and around the environment in which I am in and around the communities that I am in. I'm going to look at the problem with the eyes of a problem solver, with the eyes of an innovator, and I'm going to identify how I can solve this problem. We are a country of 1 billion people with 1 million challenges, but 1 million challenges are 1 million opportunities for the entrepreneurs of tomorrow. And this is why the Atal Innovation Mission was launched, in order to not only create a culture of innovation in our schools and colleges and in our industry, but also to create that ecosystem that will support startups to grow. And look at how it has blossomed in the last 5 years. In the last 5 years, we have risen from a position of 81 to a position of 46 in the Global Innovation Index. We have improved on every parameter of ease of business. We have created more than 60,000 startups in the last few years. We have more than 90 unicorns, and more than 40 unicorns were born during the COVID-19 year last year. Isn't that amazing? What it shows is we are all in the world of innovation and startups. The world of tomorrow is the world of innovation and startups, because startup and innovation has become easy. 3D printing is revolutionizing the way you can conceptualize, define, design, prototype, and manufacture a product right in front of your eyes from your small Kirana store, from your lab in your college, or even from your home. Robotics is driving the next degree of automation, and sensor technologies are getting integrated, or IoT, Internet of Things, is getting integrated into man, machine, device, soil, and space. As a result of which, you are able to gather large amounts of data generated not only by social feeds and communication technologies, but also from the sensor technologies that is getting integrated everywhere. And communication technologies are advancing rapidly. You have 5G technologies, satellite technologies, wireless technologies, all making an impact. And that's able to transmit this large amounts of data that you're gathering from various sources and be able to communicate it between man to machine to machine, factory to factory, country to country. And then you have computing that is advancing so rapidly with supercomputing, nanocomputing, distributed computing, object-oriented computing, and so on. You are able to process all of this data that is gathered at lightning speed. And using powerful software algorithms like big data analytics and data mining, you are able to process this data in order to arrive at meaningful information, patterns that you are seeking, so that you can take action upon the data that you are gathering. And because of all of this, artificial intelligence is becoming a reality. You see, when I was in school and when I was in college, actually we had a movie on artificial intelligence, 2001 Space Odyssey. But artificial intelligence never made sense until now. Because of this convergence of advanced computing, advanced communication, and advanced sensory technologies and big data and processing technologies, you now have the ability to process them and mimic the human intelligence to create artificial intelligence-based solutions. That, my dear young students, is allowing every one of you to reimagine a new world, reimagine new solutions for problems that have not been solved, reimagine solutions for problems that have already been solved, but not solved very effectively. And in a country like India, with 1.3 billion people, we do have a tremendous opportunity. What is the opportunity in front of us in India? Let's look at our country. We have 650,000 villages. We have 715 districts. We have more than 8,000 small towns and cities, and we have only 8 tier 1 cities in our country. Everybody is trying to flock into cities like Mumbai or Chennai or Calcutta and Bangalore and Hyderabad and so on in order to seek a life and to seek a livelihood. However, what we need to do is create 8,000 towns or hubs of innovation and job creation. That is the opportunity in front of us. And how do we do that? In order to do that, in order to ensure that our 650,000 villages become hubs of innovation and job creation. And what do I mean by that? Take, for example, the city of Goa. If you are able to breed and stimulate innovation for the fishing industry, for the tourism industry, for the cashew nut industry, for the shipbuilding industry, or for the mining industry there, you are now creating plethora of jobs for the local people in Goa. Similarly, every city, every town, every district of our country is unique in some manner or the other, blessed with either a landscape or an environment in which agriculture can thrive using precision agriculture, or handicrafts can thrive because of historical evolution of the handicrafts there. How do you ensure that leveraging digital technologies and 3D printing and CAD/CAM design and so on, we can create handicrafts which are our ancient handicrafts and sell them from Jodhpur to Japan, from Salem to San Francisco, from Sikkim to Seattle? The world has become our marketplace. The globe is our stage. We are global citizens connected in a global world where the opportunity is not just India, but also the rest of the world. But the opportunity to India itself is of tremendous value. As the Honorable Prime Minister remarked in Atmanirbhar Bharat, there are 5 pillars upon which our country's future stands and Atmanirbhar Bharat stands. The pillar of demographic dividend that I talked about. What is the pillar of demographic dividend as an opportunity for us? That's an opportunity to create startups which will focus on the education sector. This is why we have 5 unicorns just born last year in the education sector, like Baiju and Upgrad and so on and so forth. We need to ensure that our people in the remotest part of the country get the benefit of quality education, world-class education. Every classroom becomes a global classroom because of digital connectivity. And you, my dear young students, can imagine new solutions and new skills that can be imparted to our people in the remotest parts of our country so that they become job ready, they become potential innovators and job creators. The second pillar upon which the Honorable Prime Minister said our country stands is the pillar of infrastructure. We need world-class infrastructure across our country, across the 650,000 villages, across the 8,000 towns and cities, so that they all become hubs of innovation and job creation. What it means from your point of view, it means creating smart infrastructure, leveraging smart technology. Technologies like IoT, miniaturized electronics, augmented virtual reality, artificial intelligence, and so on. We need smart villages, smart housing, smart cities, smart districts, smart renewable energy systems, smart electricity, electric vehicles. We need to be able to create smart solutions and integrate this technology component in every possible solution that we can think about. That enables us to be able to create huge opportunities and address the third pillar, and that is the pillar of demand. We have 1.3 billion people spread over 715 districts. And therefore, this demand that we have is huge. This demand, remember that we have only 300 million people in the middle class economy. We are a country with 1.3 billion people. In the next 5 years, we are going to add another 300 million people at a minimum to the middle class rising economy. Isn't that a great opportunity for all of us to tap into? And if you do not become entrepreneurs and startup creators and innovators of the future, somebody else is going to take this cake and eat it. We do not want people coming from outside. That's why the rest of the world is flocking to India to be able to address this huge pent-up demand of 1.3 billion people. The fourth pillar is the pillar of socio-economic progress. We need to ensure that not only are we growing as an economy, but we grow as a society. You see, out of the 715 districts that we have, 115 of them are called aspirational districts because they are at the bottom of the pyramid in terms of basic access to healthcare, clean drinking water, sanitation, waste management, and affordable housing. We need to address this, but every one of these problems is again an opportunity. So that is why through the Atal Tinkering Labs, young students in schools between grade 6 to grade 12 are creating robotic-based waste management systems. They are creating solar panel IoT-based irrigation management system. There's a girls' school in Salem, Thoothukudi, which has created this solution. There are schools in Sikkim who have created this robotic waste management solution. There are students in Jodhpur who have created IoT-based surveillance management systems, and so on and so forth. Every one of them, my dear young students, is an opportunity for a startup, which is why today we have more than 60,000 startups. We are one of the fastest growing startup ecosystems of the world. We are one of the fastest growing unicorns, one of the fastest growing unicorn ecosystem in the world. 1 out of every 13 unicorn in the world is coming from India today. That, my dear young students, is the opportunity for all of you. And finally, the fifth pillar that Atmanirbhar Bharat talks about is the pillar of technology. You have to get familiar with technology. You don't need to become an expert, but you need to get familiar because technology is changing so rapidly. You need to know how to leverage this technology for creating new solutions. Technology which is becoming affordable, accessible, available, and advanced. And therefore, that is the glue that will strengthen all the 5 pillars. That is why you have a country like Israel, for example, leveraging technology for precision agriculture and creating an export of food products from a desert. Imagine creating export of food products and export of water, clean drinking water from the desert. They are leveraging IoT technologies, moisture sensing technology, precision agriculture technology, satellite and communication technologies to be able to address it. They're also using it for cyber security because more and more of us are depending upon the cyber and the web and online transactions, mobile payments, and so on. India is also one of the fastest growing mobile ecosystems of the world. We have three things that are going for our country. One is more than 1 billion smartphones are getting introduced in our country. More than 1 billion unique IDs called the Aadhaar IDs or biometric IDs are there, which is enabling us to think of newer applications. Gone are the days when we are writing checks for anybody. We are doing mobile payments. We are doing online transactions. Everything is being done online. People are delivering food and every other item to our houses. So that is all happened in just the last 2 or 3 years. The COVID-19, in fact, has been an accelerator of innovation. So my dear young students, you all are in the midst of a watershed moment in the history of India, where we have the tremendous opportunity to become the leaders in the world of tomorrow. But for that, you need to have tremendous belief in yourself. The great Swami Vivekananda said, if you have belief in 1,000 gods and goddesses, but do not have belief in yourselves, you are doomed. So my dear young students, have tremendous belief in yourself. Yes, you can. Yes, I will. Yes, I can make a difference. Yes, I will leave a ding in the universe. Yes, I can, said Obama, and rose on to become the first Black president of the United States. Yes, we can, said the people in the United States, and had a man in the moon in less than a decade after John F. Kennedy made that famous pronouncement, we will put a man on the moon in this decade. And they did it even before the decade was over. And I'm talking of 1960s. So my dear young students, there is tremendous power if you have faith in yourselves. And at the same time, as the great Swami Vivekananda said, arise, awake, and stop not till your goals are reached. So may I request every one of you who are in this call, including the teachers, including the parents, including the faculty, including the specialists and the mentors and the speakers who are out there helping everybody. Let us arise to the challenges, but more importantly, the opportunities that India faces and the world offers. Let us awaken from within us that inherent talent, that capability, that curiosity and creativity that has been always a part of us, but which often doesn't find expression because we limit ourselves voluntarily. And let us stop not till the Atmanirbhar Bharat goals are reached, the world's United Nations Sustainable Development Goals are reached, and more importantly, your own personal aspirations, aims, dreams, and goals are reached. Thank you so much for giving me an opportunity to share a few thoughts on this particular occasion.
What a session. Thank you very much, sir, for such a motivating session and a thrilling for all the startups and entrepreneurs. As we school is very keen at the innovation, as 10, 12 years back, we had established the innovation cell and innovation lab and fully equipped all the technologies you were talking about. We have a RedX technology lab, which is earlier funded by the Tata Trust and affiliated to MIT Boston. We have almost 10 3D printers. So I just was relating us to with your thoughts that we are just well equipped, and our students even they think in the similar line. The question from me first is, as you know, this is a business school, and most of our students think into the business ideas or in the service sector startups, and they just want to have some innovation into the business management domain. So what is your advice for them to how to get into the things and convert their idea into the startup or a product?
Yeah, very good question, Dr. Vaishali. You see, the world of a startup is one of seeking to solve a problem, okay? And the problem may be a problem that exists today, a problem which has not been solved, a problem which has been solved but not been solved optimally and which can be refined and done better, or a problem that you are anticipating in the future. You're looking at the future and you're saying, these are the problems that are going to happen at some point in time and we have to take care of it, right? So the first thing is, you have to arouse the curiosity. You have to look around and get the knowledge about what are the problems that you see which have not been solved or which are potentially solvable. And second, I think it is important in today's world because it's not possible for a single person to just innovate. Build a small team, go with 3 or 4 people who are close to you, and you may bring a mixture of skills into that team. Somebody is a business person, like you're from business school, but maybe also induct somebody whom you know who is familiar with technology or with engineering and all of that, because if you're creating a product or if you're creating a solution, if it is a service on existing products, you may probably not need that. But in today's world, technology is becoming so integral, not only in the manufacturing of a product, but in the distribution, marketing, communications, and all of that. So it is important to have somebody who knows technology, somebody good in communication, because a good idea needs to be expressed itself, and somebody who is good in finance, because you need to build a business plan in all of this. Now, the same person may have multiple skills, but you need to have all of these skills in order to become a successful startup. And then third is you have to be able to test your idea through a prototype. An evolutionary prototype is the best way of making a successful product. If you see iPhone today, iPhone is in its 13th version. iPhone 13 Plus is today's iPhone. And when did it start? It started off in 2006 or 2008. And for the last 15 years, this single product has been evolving and evolving and evolving and getting re-engineered and refined and getting better and better. So very often innovation, and most often innovation, is one of further and further refinement. Even if you take the electric car by Tesla, right? It has gone through so much of evolution today. It is amazing. And in the process, you are able to think of new innovation, whether it is battery innovation, whether it is car design, whether it is so on and so forth. So there are many, many elements. So when you take a product, the re-engineering and reiterating of the idea and running it across a small customer base and testing out that idea before you launch it as a product is very important, because you should get customer feedback. That's where design thinking comes into play, right? And you need to acquire some of the skills, and there are many, many platforms today to enable you to get the skills, entrepreneurial skills. What does it mean? How do you attract the investment world? Because you may start investing in your product to begin with, but you will need soon a source of funding. And there are many, many avenues of funding today, whether it's from the government. Actually, if you look at Startup India, there are so many possible schemes, seed funding schemes, incubator schemes, community innovation center schemes, and so on and so forth, and then loan granting schemes. All of these schemes are available, and you have to take a little time and see all of this, because that will help you in making your startup journey very, very successful and progressive.
Thank you. Thank you so much, sir. Sir, we have a healthcare program as one of the PGDBM in healthcare, and one of our students, he just want to ask the question, can you just throw some light on some government initiative fundings for the healthcare-based startups?
Yeah, so there are many schemes. I think the Ministry of Healthcare has already launched quite a few incubators where you can offer your solution and become a startup, and they will provide the infrastructure support and ecosystem support for the startup in healthcare. Also, during the COVID-19 has really brought its very sharp focus on healthcare. Because what are the problems with healthcare? It is not just the medicines. COVID-19 medication is one part of it. Vaccines are one part of it. But the other part is the distribution systems, the contact tracing system. There is a whole ecosystem that is needed to support the administration of hospitals, touch points, oxygen concentrators, PPE equipment, masks. All of these have sprung into existence today. And there are many problems and challenges India has. Like I said, we have 650,000 villages. So, the healthcare in all of these is quite abysmal in at least 115 of those districts, which are at the bottom of the pyramid. And the government has launched schemes like Ayushman Bharat and so on, which is enabling you, if you have a solution or if you have a way of contributing to that system, then you can join the Ayushman Bharat schemes and you can start off your healthcare. And then the other thing today is, you have preventive healthcare, you have curative healthcare, and you have assistive healthcare. So all of these are new areas for you to tap into. If anybody wants some further inputs, feel free to send me an email. You have my email ID. You can share it with them. I'll be more than happy to give further help to anybody.
Okay, thank you, sir. I will just share the email IDs with the students. Sir, one student, Mansi, is asking question is, what does digital transformation really means for today's business leaders? And what are the barriers that usually block the path of digital transformation?
Digital transformation in today's world is a lot of things. Okay, at the core is leveraging technology for supplementing or complementing many of the operations that you are doing. Take, for example, you have, you're maintaining records in your school, and they're all physical records. So how do you maintain digital records? And how do you develop an online recruitment system, an online training system, all the things that you're talking about today? If you want to digitally transform, how do I make all my text, my lectures, my teaching material available online? How do I do my self-assessment online? How do I, for example, interact with a teacher or a mentor online? So you are digitizing various practical operations that you see in your daily life, but which take more time, which are less efficient, and which are less reliable. So you're converting that into digital transactions. When we talk of digital transformation, it is not just you doing some changes to your organization. You're also plugging into other organizations. This is called the digital supply chain. So the entire supply chain. So for example, if you are connecting to as an institute, you are connecting to other universities, right? And you get access to global technologies. You connect to a global university, you find a partnership with, let's say, MIT Boston. How do you make sure that teachers from there can teach your students and so on? Now, this is a supply chain of teachers and faculty and expertise and resources that you are making available. So when you talk of digital transformation, you need to see how you can plug into other digital systems and connect with them so that your end-to-end supply chain becomes a digital supply chain. There are so many changes that can happen, but that's where these technologies like online technologies, IoT technologies, how do you make your classroom a smart classroom? How do you ensure, for example, that people who are coming in, their temperatures are automatically detected and they are warned if they are, if their temperature is higher in a COVID-19 scenario? How do you use smart watches to give you an integrated self-tracking healthcare system? Today, everybody is counting the number of steps using that. This is all digital transformation that are happening. So I'm sure the young students are more familiar with all these changes, but there is still a lot more to be done in the digital transformation world.
Sir, next question, we'll take two more questions. Kshitija is asking, data and data security is very important, but the digital infrastructure still that is in a challenge stage, that is still in the bottom of the pyramid, can be a barrier for being technology ready. What can government combat that, and what role we can play here in the
I think it's a very important point. That is, what is the name?
Kshitija.
Kshitija is brought up, and thank you for that, because cyber security is now one of the most important areas in a digital world. How do you make your transactions secure? How do you ensure that privacy, confidentiality of information is maintained? How do you also ensure that you are not, your knowledge about you is not being misused out there, right? You are on Facebook, you are on Twitter, you are on LinkedIn, your pictures are there, your family's photographs are there. You don't want any of this information to be misused. You're doing financial transactions. You don't want somebody to track and know and start transacting on your behalf and emptying you of your, cyber crime is such a big thing. So the government is very seized with this initiative. In fact, I don't know whether people know, we are among the top 10 in the world in terms of cyber awareness. India is among the top 10. And not surprisingly, because we have 1 billion Aadhaar IDs and everybody is using Aadhaar. So, the awareness is high. There is a cyber security cell, which has been a national cyber security and cybercrime cells which have been formed. They are working closely with many universities across the country, the top universities. They're also working with international party because, in cyber, the world becomes a stage. It is not just your country, right? You can access your account from Nigeria or some, any other part of the world. So you need to have collaboration. All of this is there. But from your point of view, from the student's point of view, I would say this is a very exciting field, and you should actually, this is a gold mine. If you are able to come up with cyber secure solutions, services, and so on, that's a great entrepreneurial area. Of course, you need to study about algorithms, encryption, decryption. Blockchain is now becoming so popular. So anybody gets trained on blockchain, you will be in great demand because blockchain is enabling end-to-end traceability of every transaction. It is a distributed ledger system. And in a distributed ledger system, you don't have a single point of failure. You need multiple points of failure in order for something transaction to fail. And that's not possible because of the way blockchain is structured. So there is huge opportunity in blockchain, in cybersecurity, cyber services, and so on.
Thank you, sir. Again, I started with my first question and I will end up with my first question is, before COVID, the competencies for the, entrepreneur was a bit different, and after COVID, what change exactly you want to suggest to the students as per the competency per se?
So, before COVID, of course, we were free to move around, attend classes, meet with people, interact a lot more closely, and so on and so forth. The COVID-19 situation has made, put restrictions on all of this. But I also think that we need to be, it has also introduced new ways of learning, which was not there before. If I look in a post-COVID world, digital technology, online learning systems, online assessments, conferences like this has become more. In fact, I am speaking to more number of students and more number of universities now than I was doing even when I was physically traveling from one place to another. So I think these are the positives of a post-COVID world. But at the same time, I would urge colleges like yours and universities like yours to bring still that blended learning capability in universities and colleges, which means you don't, how do you structure your classes so that 1/4 of the class is attending and you're keeping social distance and so on, but still you're facilitating that, the physical interaction, the physical movements, the physical meetings are important. But you have to take necessary precautions as the situation demands. Also, we need to become more innovative in our, this has bred in a completely new world of innovation. There is innovation happening across in every part of life today. Whether it is cleaning the streets, there more and more robotic based waste management is being done. More and more precision agriculture is being done. More and more remote management and remote access because of technology is being done. So all of this become the huge opportunities for the young students.
Okay, thank you so much, sir. Thank you for sparing your valuable time and guiding us in the innovation space. And on behalf of the entire conference team and the We School, I thank once again for guiding us. Thank you so much. Namaste.
Thank you so much. And thank you for the opportunity that I got to share a few thoughts. Yeah. And feel free to connect with me anytime. Yeah. It's always my passion to help young entrepreneurs progress towards their dreams.
Yes, sir. Yes, sir. Looking forward for your physical visit to the We School.
Yes, I will come. Definitely.
Yes, sir. Thank you so much. Namaste.
Thank you.
Okay. Participants and audience, we are starting that plenary discussion on startup within 5 minutes. Please remain on the same link. Thank you so much. Dr. Kaustubh, you can switch on your video as all the panelists have joined.
Hello. Welcome, Poini ma'am. Welcome, Sohit. Welcome, Rohan. And welcome, Samir. How are you all?
Good morning.
Thanks.
Hi.
Thanks.
Good morning.
Hi. Good morning. Hi.
Good morning.
Thank you. Yeah. In a minute, I think it's 11:13. We'll go live. Thanks for coming. So, generally, how are you, Poini ma'am? After a long time.
Very well, thank you. And I see Mr. Ramanan still here. It was wonderful as usual, Mr. Ramanan, to
Absolutely.
listen to you as usual.
Yes. Very inspirational.
Yeah.
So, yeah.
I don't think I have met my colleagues here. Sohit, Samir, Rohan. Morning to you all.
Good morning.
Hi, good morning.
Hi. Morning.
Pleasure to connect with you all.
Yeah.
Likewise.
Wonderful to have you all here.
Thanks, Kaustubh.
Yeah.
In fact, I'm quite an odd person out here, not in terms of gender, but like I'm not from startup. All of you are from startups. So
You are from the hub of the startups.
You are the mother of all of them.
looking forward to listening to your impact stories. Yeah.
You have taken my statement out before the introduction.
Sorry to steal your thunder. Yeah.
Just have about a few seconds. Yeah, let's go live. Yeah, we're going live now. All right. So, welcome everybody to this session on startups, the drivers of innovation and value. What does innovation mean in the Indian context? What does value mean in the Indian context? Is innovation only about creating new products? It's much more than that, right? In our country, it's about creating better access at the last mile. It's about making stuff more affordable. How can we ensure proper governance? How can we create a more equitable society, et cetera, and the list would go on. As Dr. Mashelkar would say, create more from less. So that's going to be the theme for this discussion. And for this, we have 4 eminent panelists here. 3 entrepreneurs who are living this spirit of innovation and value creation. And the 4th is the mother of them all, who helps startups achieve their dreams and create value for society. So let me introduce all of you, all the panelists. Let me introduce the mother of them all, the first, Madam Poini Bhatt, the Chief Executive Officer of SIGN, the incubator at IIT Bombay, Society for Innovation and Entrepreneurship. Madam Bhatt is the founding member and the Chief Executive Officer of SIGN, the Technology Business Incubator at IIT Bombay. She's been involved in more than 200 startups supported by SIGN since 2004 and actively mentoring startups and innovators outside SIGN as well. She has handled several collaborative international programs for innovators and entrepreneurs. Most recently with Switzerland and Canada, startups supported by SIGN have collectively raised approximately $600 million with a collective valuation of $2.48, $2.5 billion. SIGN also has a few unicorns in their portfolio. Prior to SIGN, Poini ma'am has had corporate experience of over a decade in manufacturing and the investment banking sectors. She's a member of several committees of government, trade and trade associations for innovation, entrepreneurship, and incubation, and also a member on the boards of several incubators. A warm welcome, ma'am, to the panel.
Thank you.
Now, let me introduce Mr. Sohit Kapoor, founder of Briefcase, spelled as DR Capital and IEFCAS in lower caps. An ex-investment banker with Merrill Lynch, Sohit is the founder of Briefcase, where the mission is to use longitudinal healthcare data to keep various stakeholders get better control on their respective health journeys. As all of us know, the government of India has launched the Ayushman Bharat Digital Mission, ABDM, the India Health Stack. So it actually helped design the ABDM framework, providing a unique user perspective, making the framework more patient-centric. Briefcase is the first B2C platform to be certified by ABDM. That's a great achievement. Briefcase will soon be the patient's gateway to ABDM, something similar to what Google Pay has been for UPI. Having spent more than 5 years building Briefcase, he's passionate about building companies that leverage technology and data to solve complex customer problems and create meaningful experiences. Prior to Briefcase, Sohit led corporate finance and financial sponsor teams for Merrill Lynch investment banking in India. During an 11-year stint, he advised top Indian and global corporations and several marquee M&As, private equity and capital raising transactions accumulating to over $20 billion. He was a part of multiple SEBI committees developing the framework for new regulations. Sohit is a computer engineer from Mumbai University and an MBA from IIM Bangalore. Welcome, Sohit.
Thank you so much. Thanks for having me here.
Let me now have the pleasure of introducing Mr. Samir Chaudhary, co-founder of Media Ant. Samir has been a marketing person throughout his career with leadership qualities. After his engineering, he did his MBA at IIM Bangalore and worked with Reckitt, Redbus, and Britannia before he co-founded Media Ant. Samir's mantra for startups is make something that people want. He also says that it is easier to start with a niche, master that market, and then expand into the broader market. It's very important to keep experimenting till you find a good product market fit. His life mantra, do what you enjoy doing, and his tip for success, believe in your dream and in your team. Welcome, Samir. Nice to have you here on this panel.
Thanks for the warm and nice introduction.
Welcome. The fourth panelist is Mr. Rohan Chaudhary, co-founder and director, SAR Cellulabs Private Limited and SAR Diagnostics Private Limited. He's a B.Pharm from Guru Nanak Institute of Pharmaceutical Science and Technology, postgraduate from IFIM Bangalore. He is a certified digital marketer from Google, an innovation award winner for brand MyCord from the Indian Society of Cellular Therapy, and many more awards, many more citations. A marketing professional with a passion for creating and building brands, an experienced sales trainer, a well-rounded work experience for over 10 plus years spanning category and brand management, P&L management, strategic planning, product innovation, consumer insights, and business development across the healthcare and FMCG sectors. He quit his professional career in 2020 to start his entrepreneurial journey by starting SAR Cellulabs Private Limited and SAR Diagnostics Private Limited. And most importantly, students remember, he lived that journey with two professional colleagues by co-founding a private limited company with 2 lakhs as loan, which has grown to 15 crores turnover within a span of 2 years. Welcome, Rohan.
Thanks a lot. Thanks a lot for the brief description for me.
So we have a power-packed panel here, and all of you are going to get tremendous insights, students, from their discussions. As I said, let us start with the mother of them all first, her experiences of helping all these people live their dreams, right? So the pattern that we'll follow is, about 12 to 15 minutes per speaker. In the meanwhile, students will kind of upload some questions in the chat window. I will also have some questions, and let's have it as a freewheeling conversation rather than a watertight 10-15 minute kind of a thing. So even if if you feel when a panelist is, somebody else is making a point, and if you feel you want to add something there, you're most welcome to do it. I hope the others wouldn't mind. So let's keep it as conversational and interactive as possible. All right. Over to you, ma'am, Poini ma'am, please.
Thank you very much, Dr. Kaustubh. It's really nice to be here. And then I joined about 10-15 minutes back, and I was listening to Mr. Raman, and when he speaks, the whole environment is very charged up. And being part of this a panel with colleagues who are entrepreneurs, who are representing, the entire startup, basically, what I would say, ecosystem here. Yeah, I don't think you really need to debate the, or you really need to go beyond this, that like startups, that they are driver for innovations and entrepreneurship, whether there is, value, innovation, value, technology, so on and so forth. So there's no debate about it. We all are really excited about startup, yeah. I started this journey in entrepreneurship world maybe about 2 decades back, 18 years back to be very precise. The milieu was very, very different at that time. You talk about 18 years back, no investor, no angels, no corporate engaging with startups. Startup by themselves were very minimal. There were no role models in startup ecosystem. In less than 2 decades, if you really look at it, we are third largest startup nation globally. Yeah. Bangalore became the third largest city to have attracted, third largest basically startup capital invested in Bangalore-based startups. Yeah. $42 billion alone got invested last year. Yeah. That is in 2021. So this tremendous confidence and tremendous buzz around startup that is happening. And let me tell you, this is not really a bubble. Though much of the fundraising has got in growth capital, and maybe small number of startups, but you also see now startup in very, very different space, not only aggregation or e-commerce kind of space, but you see startup in automotive, manufacturing technology, long gestation period, like healthcare or space tech, defense, those kind of, space which were unheard of in the past, clean tech and everything. Yeah. So there's lots and lots of basically, activities are happening there. They all are driving innovations. They are leveraging technologies to scale themselves, generating IPs, getting funded round after round. Some are becoming unicorns. Some are going to basically IPOs, providing exit, wealth creation for their investor, employees, so on and so forth. Yeah. It's not about, look at the global picture. Top US market capitalization, the company that drives the market capitalization, Amazon, Microsoft, Google, Facebook, yeah, Apple. Yeah, these are top 5-6 companies. They all were startup at one point of time. Yeah. Not only they have generated value, for their investors, but they have actually made the world, each of us, captive in their realm technologies. Yeah. They have changed our behavior, they have changed our way of functioning, like humongous impact just by leveraging technologies and innovation. Yeah. Uh, Mr. Ramanan talk about digital transformation, right? And those who are born in my generation or maybe decade ahead of me or after us, we have actually witnessed the change, the way change, the way we operate or transact our activities. It has changed the life. It has disrupted the traditional mode of functioning, the way we access information. Yeah. Olden days, you go to library, you read newspaper, you read magazines. Yeah. And most of them comes as a historic information, maybe like, 1 day older to many years older kind of thing, right? Today, we access information almost on real-time basis. Our first touch point is maybe in online information, internet, and then we drive like, in physical books and all those stuff. The way we communicate, yeah, internet or smartphones, they're leveraged like and it's like never before. Like maybe internet and smartphones are basically, I would say game from the large corporates, but the whole ecosystem or the whole technology and tools that are basically installed on those smartphones, which make the phone smart, let me put this way, they're driven by startups. Yeah. The way we travel, like, none of us stand in queue to book ticket, whether it is a bus travel or train travel, or we don't use even agent to book our air ticket. Everything is online. Yeah. Even like, taxi or bikes, everything at a click of our, you know, uh, phone basically. And we have Ola, Uber coming, the way we eat, the way our buying consumption, basically, pattern is driven completely online, right from grocery to vegetable to what we wear, like, shoes, clothing, specs, chashma, anything you talk about, pretty much whatever you say, like, it's online. And list can go on and on, like, the way we learn, the way we operate, or banking, and so on and so forth. These most of these disruptions are actually led by startups, and in the process, as an end consumer, how does it work? Like, we get ease of operations. Yeah. Much of our like transactions are economical, cost effective. It saves times for us. Yeah. Most importantly, it also bridges the divide between urban and rural, rich and poor. Like, my vegetable vendor, when I give them cash, they said Google Pay karo ya Paytm karo. Yeah. This is what is enabled by startup. Let me put this way. So it actually divides, it bridges the gap actually. And also gives through so many competition out there, so quality is ensured here. Yeah. And this talking about kind of a online or e-commerce, which is enabled by online or e-commerce or aggregation economy. But let me also share 3 examples from different space, which actually have physical product and how they have changed the, they made impact in their respective domains. Defense, retail, healthcare. These are the 3 stories I'm going to share with you. Yeah, and they all are Indian companies. They are doing something which is never done in India by any corporate or startup before them. Yeah. And these are very unique story, like, which builds lots of confidence in our ecosystem. So I don't know any one of you have heard the name of Idea Forge. Idea Forge is a defense company. They make defense surveillance drones. Drone as surveillance or unmanned aerial vehicle as surveillance is very common these days, but not in like, late 2000 or early 2010s kind of thing. Yeah. The company was incorporated in 2000, I think in 2009, so just 12 or 13 years old company. It was set up by young graduates, very, very recent graduates from IIT Bombay. Yeah. Started with some different product and pivoted to this defense product. When you are a startup and you deal with a government sector or defense sector as your customer, I don't think you are going to get investor money. Yeah, ask any investor. Investors' confidence in government as a customer is not really very significant because it's a very complex market actually. These boys managed to raise some small money, made drone, which is unmatched. And I'm telling you, it is unmatched globally in their category of drone. Yeah. They can fly in higher altitude of Ladakh. It weighs around just 6 or 7 kg. And look at the wing and harsh environment that at that level altitude, right? Remain stable, sends out input, analytical input, to the defense forces on all the borders, like on the northern and eastern borders. And now this is the company which delivered $20 million worth order in a single year. Yeah. And just to give you an impact, yeah, their drone or their vehicle flies every 6 minutes in the country daily, giving out live surveillance input to the defense authority on real-time basis and on real-time view. So it's a color view with all analysis, basically they are giving it. Amazing company. They got now, just because of their execution, they got the investors, market investors like Infosys and like WRVI. So all global investors are lining up and now defense is placing another large order with them. Yeah. Amazing story of, young graduate from a company just 20 years old. And defense, I'm talking about government as a segment. Yeah. Second story that I would like to share basically is of in a retail segment. Very simple product, very, very general category. It's an electric appliance company. The company's name is Atomberg. Atomberg makes gorilla fans. Yeah. Fan pe company kaun banata hai? If you really look at it, that would be the reaction. Yeah. Majority market. Again, these are young graduates from IIT Bombay. Majority market basically is governed or at one governed. In fact, it was predominantly basically, captured by Crompton Grays and Bajaj kind of people. And these are the boys, saw this opportunity. And what was the opportunity? In fan segment, there's no innovation in last 50 years. Ever since there were not 50 years, no single innovations, right? Fans are installed pretty much in every household. Yeah. Every commercial establishment. Yeah. And each fan, I think it consumes about the 75 to 80 watts kind of thing. They saw an opportunity to actually introduce some disruptive technology to save energy. Yeah, energy consumption. They made a fan which on wall saves energy up to 60%. Yeah, their fan costs somewhat on higher side, but ROI is just less than 1 year. Yeah. Imagine a company in a fan. I'm telling you, it's not easy to make, enter in this space, And now Gorilla Fan, I don't think it's a household name, but I'm sure it's on its way of becoming a household name. Really giving, large corporate run for their money, if you really look at it. The company again is funded by large investors, celebrity investors like Deepika Padukone, family funds, and so on and so forth. This is another thing, very impacting every common person and doing very, very impactful of energy saving. Yeah. Third story, it is a science. science-based company, really deep tech. In fact, all three are deep tech companies, yeah. But it's a science-based company in healthcare space. The company's name is Immunite. The company is just 3 years old. Yeah, it's less than 3 years. In fact, it got spun out again from IT Bomb. So I'm giving you only local stories because I deal with incubator and I would really like to share stories of our incubators here. So this is the company. It is in area of cancer therapy. Yeah, when you talk about cancer, we have typically we heard these words of radiation or chemotherapy and so on and so forth, right? There's third therapy that which is now coming in the market. It is already there in the US. Novartis and Gilead kind of large pharma companies have introduced. It's called immunotherapy. So the science behind or engineering behind is that you take out the cancerous cell, you bioengineer them, you again infuse them in the body, and this bioengineered cell will immunize growth of cancer cells. Yeah. The therapy, which is not available in India as of now, it's available only in the US and perhaps few countries in Europe. And therapy costs anything between 2 to 3 crore. Beyond of any middle class, means. Yeah. This is the company developed that therapy. Yeah. They are the first company in India to have got regulatory permission to perform human trial. They are doing human trial as of now. I understand they are already performing human trials on about 10 patients or so. Extremely positive outcome. They are still doing human trials, so I cannot say much about it. But what I understand is that early indications are very positive here. Yeah. Even they got synergistic funding out there. But the key thing is that it's a domestic technology, indigenous technology, and the aim is to basically bring out this therapy at the cost of 15 to 20 lakhs per patient. Yeah. Here is these are the startup stories basically who are generating value, wealth, but most importantly, they are changing the society. For if you really look at it, startups, they drive innovation, they drive technology, they generate employment, they generate wealth, they create smart workforce, yeah, who perhaps could become next generation of entrepreneurship. And most importantly, they change the perception of the country or a nation, which is happening for India as of now. I think I'll stop here. Happy to converse more. Thank you very much. You're on mute. You're on mute.
Thank you, ma'am. Very inspirational stories. And she has so many more. She's restricted them to 3. And she hasn't used her 15 minutes. So I'll come back to you later. I think the drone that you were referring to is the one that we saw in 3 Idiots. Is that Idea Forge?
Yes. Very much.
Yes. And wonderful. I mean, 3 different triggers for innovation with these 3 companies. One trying to save energy, one trying to bring the costs down, and the other trying to enhance the surveillance capability. So opportunities lie everywhere. With that, I would invite Rohan to speak.
Yeah. So just 1 second. Sorry, Rohan, before you start. So this is one thing, but I think this is also a story of Atmanirbhar before this term was introduced in the country. So I'll stop now.
Yes, absolutely. Yeah. Thank you very much.
Yeah. Hi, everyone. Thank you very much for calling me into this eminent panel discussion. Hello.
Carry on. There was a slight echo.
So, according to me, the drivers for innovation is basically the 3 things, to be precise. if you see from an entrepreneur's point of view, it's a problem, identifying a problem which is there into the market, constraints that identifying them, that why these people are not solving that, those who are having a big resources, they are not resolving that. So identify a problem and having a constraint. And third thing is, if you start it, then it's an opportunity for you. So exactly what happened for me in is basically
Rohan, I think your voice
there
is
is a three colleagues of mine.
Rohan, your streaming is extremely choppy. Maybe you could switch off your video, then the audio might come better, possibly. Yeah, just try now.
Am I audible now?
Much better. Yeah.
Yeah. So for me, what I am saying is we are having three major ideas for innovation to, in my view. So identifying a problem which is nobody is solving it. And then you go into what are the constraints that everyone is not solving it. And because people are the companies, the existing companies are very big with big resources. They are not resolving it. So there is an opportunity for an entrepreneur to start its journey. That's exactly what happened for me in SAR. Basically in 2020, we three colleagues who left their job and thought like we will start something. We started with what ma'am rightly told, biomedical engineering. So we have a background of stem cells in India. So what we thought like we'll start something of our domain. But in 2020, when we started, within a month's time, there is a lockdown. The national lockdown came up and everything shut down. Whatever we started, we invested something. The government told that that industry is the secondary healthcare. You need not to focus at this point of time. So what we came up of during the lockdown, we found that there is a RT-PCR test which is going on, and companies who are the existing or the big companies like High Media, Thermo Fisher and all are the only supplier for those raw materials of the RT-PCR kits. Could you imagine that time a person is actually paying 4,500 rupees for a single RT-PCR test? Because everything from the swab, from the collection kit to the test material, everything was actually coming from we are importing everything. There is not even a single thing was manufactured in India. So only for that collection tube, and the two swabs from where you get the collection from your nose and your mouth, that is actually costing around 250 rupees for a customer or for a testing person. Right now, with the innovation or when the people, Indian companies started manufacturing it, it comes to 10 rupees now. So you can understand what kind of margin was there with them. And that's the opportunity what we thought during this lockdown, that this thing we can come up. So started our journey. There are many barrier regulation. As you know, healthcare is having a lot of barriers for the entrepreneurs to start their journey. First is regulatory. There, if you have for example, in our case, if we passed from ICMR NIV for our product, I need to wait for 6 months to launch a product into the market. That is the biggest problem what in our sector a person or the entrepreneurs are facing. Second thing is, in this organization, if you see, a lot of opportunities there, which we have seen. When we are actually manufacturing this kind of kits, from 4,500, the tests are now done by everyone is 300 rupees or 400 rupees. It was not an easy, because for a startup, you need an ecosystem to help you out. Maybe for us, the opportunity or the problem, I rightly told there's a problem, and we taken that opportunity to solve it. So SAR is started from a city called Gurgaon, and it's basically a hub of all the diagnostic centers or the diagnostic chains in India. If you talk about all the big names are present in Gurgaon or Delhi. So the day what we faced or the nation faced, every day there is around millions of tests are happening, millions and millions, and people doesn't have that raw materials with them to actually do that. So what ecosystem given us a constant growth path for this, for our business. And that is basically helped us to bring our business down. So in my point of view, you need an ecosystem to start any kind of business to be there, because it's very difficult for a consumer to change its habit or change something which he was not doing. He always asks a question that, why should I pay you for this? For example, we started a medical testing thing in Kerala with government of Kerala. We are associated with Sandor Diagnostics, and we have a mobile vans moving across the state of Kerala. So you need not to go to any lab. The lab is coming to your home for RT-PCR test, basically. And it is completely funded by government of Kerala. That case, if you see, people that time also asking why I need to do it. If you are getting something free also, it's very hard for us to actually motivate the people or incentivize the people that, yes, you do this, this is something good for you. So those things, if you see, so these are small experience. Might be I'm having a very small experience in my entrepreneurial journey. So I might say something which can offend someone. So I'm extremely sorry for that. And
please go ahead. Don't feel shy about anything. Just go on.
Yeah.
Because you want to tell the real story to all our students, right? So
yeah, startup, I think, just to tell you, Rohan, like entrepreneurs, one of the role is to offend others because they are disruptors. So don't worry, go ahead.
And
yeah. So thank you. So this was what we have started. Now, next point, where for last 10 years, I am working into or all of our 3 members are actually working into a segment of women and child or mother and child segment. So all my brands or all my companies are working with closely with the women and child segment. And in medical fraternity, or if you see in the healthcare business, there is only one business where, or the one clientele, if you want to say, are very loyal to you, is the mother and child segment for any business. Because for example, if you are going for a testing or for a doctor, even the gynecologists who are seeing the ladies or the pregnant ladies, they are actually having the most loyal customers with them, because during their cycle of pregnancy, 9 months, a customer is always there with that doctor. So in that case, we thought we need to come up with a diagnostic chain which completely focus on the mother and child segment. Now, there is no one in the country right now who are actually focusing on mother and child. Hardly one or two players who are having a mother and child experience in different segment first. They are now starting. If you, and it's a very big ecosystem. If you see the mother and child segment, every mother is, or the every family, if you see, yearly spent around 50,000 rupees on their testings, on their apparels, on their uh, nutritious foods or something. It's a use of one household. And the birth rate of the country is around 2.6 or 26 million, 2.6 crore a year. Out of which, if I calculate only the urban population who are having a more than 50,000 income per month, that population is almost 20% or maybe 25% of it, which is a very big industry if you concentrate on that. So that, based on those insights, what we are having in our past experience, we came up with this industry and started the diagnostics. The reason behind, it's a, you can say it's a forward integration of SAR Cellulabs, what we have started, right? Because SAR Cellulabs produce the or the products which helps for the testing needs, starting from the swabs, the syringes, all those things. And diagnostics is diagnosing that person. So we came into that business, and hopefully we have found something key. You can add value into it, because people are charged very huge for their small needs. So why not we come up with a business, or we come up with a solution which will be affordable to everyone and a quality product. If I talk about the quality, for us, what we have always maintained, despite into the, we came from 250 rupees to 10 rupees product, we are now providing kits to all leading diagnostic chains, governments, and we are in verge of exports also. Our quality was established because we are the supplier from one of the supplier, or only one supplier you can see, from World Health Organization. WHO is buying the products from us. For South Africa, for other places, we need to give it to the Indian part of the WHO, and they are now supplying. So we might not know the actual which are the countries are actually taking from there. So this quality we have maintained. And if you ask anywhere that about the products, whoever, because what our thought or all our founders thought was, if first product during this pandemic, if our business partners are using it, they will be using all our products. Lastly, based on those initiatives, we already got an opportunity to work with Harvard Medical School for a project for a project on the tuberculosis, which is a grant which we have received. So those are something which we never thought will happen in 2 years' time. It might be a destiny, or maybe our complete team's hard work and day and night, whatever we have done. So based on that, what we have achieved, because starting a company and reaching where we are now, it's almost looking like it's a dream. Because if you look back, these things happen because we are an employees. We doesn't have any capital with us. We never have resources. But one thing we have, for 10 years when we are working, we have the connects with us. And that actually helped us, because if you see, when you need raw materials a lot when you are actually using it to other people, means this kind of volume. Our vendors came up to help, and basically that journey taken forward. So that's it, what I need to say.
Fantastic, Rohan. Very inspirational journey. Just a few points that I picked up from you, that adversity need not bog you down. There is an opportunity everywhere. And what I liked about the fact is that you had a solution kind of solution providers approach. Rather than trying to sell a product, you were trying to sell a solution, especially with that example of the mother and child. Understanding the whole journey, identifying the touch points, where there is an opportunity, and then going in there. Wonderful. Thanks for sharing. We'll come back to you with, there are lots of questions coming in from the viewers. Now, there are two more panelists. One is into healthcare and one is into media. I would like to break the journey of the healthcare and go to the media person. So I would like you to, Sohit, I'll come to you later. Otherwise, healthcare dominated ho jayega conversation. So let's bring in the media and the creative guys into the whole thing. So Samir, over to you.
Thanks, Kaustubh. I think like such a large causes of that these guys have taken up on the healthcare, I think media becomes a much smaller thing to discuss. But nevertheless, I think I'll try to keep it entertaining here. So I think the brief that was shared with us, and then what we've expected to tell the students is a bit about startup journey. So I'll try to just share a few pointers on how do people typically get into startups. I think one of the questions that everyone is struggling with, a lot of peer pressure, and Shark Tank adds to that pressure, saying that why are you not an entrepreneur? Either you should be a judge or should be participating, you know. So those kind of things. I meet a lot of guys who are either students or working and saying that कुछ करना है लेकिन क्या करना है नहीं पता. I want to do some startup, right? So I think I'll try to share with you guys like few pointers on how you can decide into it, and then I'll get into my the media and journey. So if you look at if I have to put a framework, right, around what kind of startups or what people should do in startups, right? There are three broad areas which actually drive people to do like start anything. Either it can be your past skill sets, right? Someone who has been a doctor would want to start a hospital, right? As simple as that. Someone who has been a tech guy would want to build an app. The second can be a cause, right? I want to pick up a cause. You have no relation. You want to do something about kids' welfare. You want to do something about people health. That can be a cause. You learn everything. And the third is an opportunity, right? That's another big area. Right? A lot of things happening in delivery space. Dunzo is delivering, Blinkit is delivering, Zepto is delivering. Let me also get into that space. Everyone is eating food. I have no cause to it. I really don't have a big cause to go and feed these middle class and rich 50 million households more food, but it's a good big opportunity. So these are one of the three areas, which is basically cause, skill, and opportunity, which drives people and help people pick what they want to do in the startup. In many cases, and most of the successful cases, you will see all three or at least two of them converging together. Right? So, like, let's say one of the best examples of Facebook, right? It was a big opportunity. It was a cause also where they wanted to connect people, and they had skills on the tech side, right? All three of them came together, right? So I think when you put all of these things, that's where the magic starts happening. So if you look at I'll use the same framework to share how the media and came up, right? So this was I was working in Reckitt at that time, and I was heading a few of their brands for the US market. And that was a time when the startup boom had just started in India. Flipkart had come up, and Redbus, and there were a few of these guys who had come up in India. And me sitting in US, I was like one of the most of the students who are there right now listening to us, saying that I don't want to miss this bus. It's cool. Like, I didn't know anything about it. What is actually a startup? But I knew that this is something which is interesting, and I don't want to be sitting on the fence and later say I wish I was a part of it. So I came back to India without a job. I had nothing to look forward to, and then I just started chatting with people. And bus ticketing became one of, like, Redbus was there in Bangalore. I had to come. I had to come back to Bangalore because my wife was from here, and we had a house here to stay. And Redbus came up as an idea at that time. And I remember having this conversation with my parents saying, and I'm from Bihar, a very, very conservative society where if you're not an IAS engineer or a doctor, you are probably have not done well in your life. Right? So I had become an engineer. So that part was checked. And first shocker I gave to my parents was when I said I don't want to work with Tata anymore. I joined Tata Steel out of campus and said I don't want to join to Tata anymore, and I want to do an MBA. They said, IAS karta to samajh sakte the, why do you want to go for an MBA and leave Tata, right? And that to Tata Steel. But I took that jump, and there's a second jump, which was actually a big shocker. Because ticket ka agent hi karega. I still remember those words, right? And if you remember, like in these small towns, right, you have these ticket agents sitting at the bus stands, right? They sell tickets to you. And I had no other way to explain that idea to my parents, saying that I will be selling bus tickets. I was saying, yahi karna tha to itna padhai kyun kiya? You could have done it easily anywhere. And that's where I said, no, this is a tech enabled. I tried to explain to them. Honestly, they didn't understand much. Paisa mil raha hai? I said, paisa bhi nahi mil raha hai. So what do you get? I said, no, I'm getting equity. So they said, I think there's something wrong with this child. Let's anyway go ahead. So I came and joined Redbus. I worked there for almost 2 years. And that's when the exit started happening. And then I moved on. So for a short stint, I was in Britannia. But during Redbus, something very interesting happened. First of all, this ecosystem I saw thriving, right? It was very, very different from what I had been doing earlier. Earlier was good fun, like large corporates, structured learning, brand names. You learn from best in the class, right? That was one good thing there, right? But again, it had the issues of what comes with scale. It becomes slower. There are processes to be followed. The innovation takes time. And Redbus was exactly opposite, right? Every night you will have a new idea to execute, and you will dump it by the evening, right? So it was that fast pace, right? Every one, like we had, if we had valued on the basis of ideas, I think would have been more valuable than Apple today. So you just keep generating ideas. That's what startup was, and exactly opposite to what you had in corporate world, right? But it was good fun. And you started working with a lot of constraints. I think we never had constraints when we were large. We had constraints, but the larger constraint. You have 100 million to spend. I think that was my constraint. And I had planned only to spend 80 million, 20 million. I still had to figure out how to spend in the right manner. Here, the thing is, I had ideas for 1 billion and I had not even a million in the bank. So one of the things happened there was when we started doing advertising, we said, let's put a few hoardings near the large bus stands in the country. So we picked up Coimbatore in Chennai, we picked up Kormangla in Bangalore, in Dholakua in Delhi. And we said, let's put up hoardings. Now, the idea was great. At night, someone came up with this idea. We said, let's go ahead now and execute. And next day morning, I'm figuring out like it's good to start, but now what? The dog has reached the car. And there's nothing I can do beyond this. So then Just Dial was the only savior, and Google, right? So started looking for searching hoarding vendors in Delhi, hoarding vendors in Chennai. We found few names. I started calling them up. Language problem. Many of them did not understand our language, my language, and I couldn't understand their language. Whatever they were giving me, I had no idea what was right. Or someone said it will cost you 1 lakh rupees. Someone who said it will cost you 10,000 rupees. Everyone claimed to be the owner of that particular billboard, right? And the data became a big challenge. And we actually had to drop that idea, because for 7 days I was just calling up people, and one day I'll get one rate, and the second day the guy will not pick the call. Right? And we had to drop that idea, and that was the first time when I realized like how an easy access of data can actually inhibit experiments. And if you're not experimenting, you cannot be in a startup for sure. So that passed. We figured a way to do it. All that happened, and then I moved out of Redbus, and then again I joined Britannia for some time. But then I realized again, this is not my calling. I have to go back to that ecosystem. And here, again, I went back to my old framework, saying, how do I look at startups, right? So is there a skill set? Is there an opportunity? Is there a cause? So I think I had that time all three of this, because I wanted to help the startups in the country. Being in marketing in Redbus, which had an exit, I used to get calls from startups almost every day saying, I want to do this, Amir, can you help me connect with the right guy? And I was doing it, and I knew that these people need help. Skill wise, I knew, because I had been sales and marketing all my life. And then was certainly an opportunity, because this number of startups every day was almost doubling. So me with another colleague of mine from Redbus, we said, let's do something cool. And I had always been fascinated by Craigslist in US. Craigslist, for unknown, it's basically a listing site. And it has one of the poorest UI that you can see in the entire world. It's just lines, that's it. And it's one of the most useful site that people use. You can get right. So it worked well. So we said, let's create a Craigslist for media in India, right? And it will be so cool. You will put up a listing, people will come, and then they will connect. So that was the initial idea. So we got some information from existing vendors. So we reached out to, let's say, a Star TV, we reached out to Google, we reached out to these hoarding guys, and we collected the information and basic information. This is the location, this is the cost, and we put up the listing. And this was time when the Social Network movie also was coming up, where there was this very cool countdown where everyone is sitting in this room and you see the number of followers going up. And that was like a thing to do. So we also sat there, and every day we didn't have that fast pace thing happening, but every day we'll see the traffic going up and up and up. And that was like, that gave us a kick. Almost 3 months passed by doing this. And then after 3 months, we started getting calls from people saying that, hey guys, you connected me. I found this number from Media, and I called up the guy. The guy said, "Kaun hai Media?" And we don't know. Whatever rate they have given, if they have given, go and talk to them. We don't know them. This rate is not right. So those guys were disappointed. Many of the vendors started calling up. Let's say a Star Plus example, not Star exactly, but someone called up, and those guys were like, "Hey guys, you have put up this information. We're getting so many calls, random calls. Everyone wants to talk to us. These guys have no money, nothing, no plan, and they're just wasting our time. Can you remove us from your site, because you are not adding any value?" So we had a successful idea, pissed customers, pissed suppliers. And 3 months later, we sat and say, what will we do in our lives? Because we haven't made any money in the last 3 months. I think whatever money we made from the exit, I think it's not going to survive. Like, it's not going to take us through our entire life, right? And at home, people started asking, like, that was time when I actually started going back to my parents and asking for money for petrol and for food, right? They were like, we did not raise you for this. I think that you have to figure out how to make some money. So all three stakeholders were unhappy. So it was a good example of where there's a good idea, good traction, but useless. And that's where the first mantra, Wakasto, which you mentioned, saying that make something which is useful for people. And we started figuring out what is useful here, right? And we talked to a few people, also use our judgment at that time. And what we figured was connecting is not the solution in a market which is so fragmented, unstructured, unrated. So we, at this stage, what we did was we started collecting the demands from the advertisers. So let's say when you come and you say you want to advertise on YouTube, or checking the rates on YouTube, I will buy media space on your behalf from YouTube. So here the customer was happy. Whatever rate media ant is giving, actually I'm getting at it. So I'll say if this hoarding costs you 10,000 rupees in FC Road on Pune, actually I would buy it from you at that price. So the advertisers were getting trust, saying that, okay, this makes sense. Now, if I go to media and I know what the price is, I'll use it as a benchmark and they will also help me buy it. So I was completing the loop on the advertiser side. The vendors were happy because I was getting them incremental business. Till now, they were getting squeezed by these large agencies and large brands where they will make them sit for hours outside and then just negotiate on pricing, everything. So they were happy they were getting incremental business. And what we would do as middlemen, we would make money. So I'll buy at 100, I'll sell at 110. So we were also happy, saying that, okay, now all the entire ecosystem was actually helping. So in this, so then actually Redbus idea, the media and idea actually started taking its real shape, where you have the various stakeholders which were doing right. And the biggest advantage that came in was the ecosystem. I think there is no stronger force than the market force. You can be a brilliant idea, you can have all the investor money, everything. If the market forces are not taking along with you, there is very little that you can do about it. But this was the time when internet penetration started improving, startup world started coming up. Media moved towards digital a lot. So we sort of became an expert, or at least an equivalent to any other guy. So earlier, like say, when you come to print, I had a disadvantage because there were guys who have been selling print for the last 80 years, and there's some fresh kid on the block selling it now, right? So we had the disadvantage, but when we moved to digital, everyone was like on equal footing, right? No one knew what was happening there, right? Every day you have one new media coming up. Google making changes almost overnight in their algorithm, Facebook coming up, Twitter, Quora, then you have this sort of Hotstars and everything came up. So we sort of became, so in the terms of skills and knowledge, it gave us parity. And the new set of advertisers, they were very, very happy to use online platforms. They did not really like this thing of setting up meetings, traveling half an hour, and then first discussing how are you, and then about discussing weather and families, and then they were like, give me the information, I'll figure out what to do. Very hands-on guys. So I think those things came into the ecosystem well and helped us grow. And then COVID happened, right? Again, how an adverse situation or a condition can still help you. So what happened, many of the physical, so when you're buying media, you have only two choices. You can buy it from media or you can buy from an offline guy. Now, because of COVID, what happened was that the offline system got disrupted big time. And a lot of people then started shifting towards the online system. That helped us move on getting a lot of traction. Because we started handling volume, we started investing more and more in tech using automation, because we knew, so just to give you some data, from about 100,000 to 200,000 visitors on the site, we moved to about 1 million visitors on the site, right? You cannot possibly service the same set of people using your existing system. So we built in a lot of automation. So we started figuring out where there was a manual intervention and how can we use tech to bring it down. And that's a continuous process. So if you see today, media and what has happened is what it was earlier, which was a pure data, like a Wikipedia for media. Now it has become like a sort of an Amazon for media, where you can come and buy media. So moving towards a complete e-commerce space. I think so. That is more or less the story of how Media Ant came up, and how did the market forces help us, and we kept evolving to be in line just to ride that wave. So I think anyone who's looking to get into a startup or start of their own, uh, it's important to just be in the game, because market forces, there's not much that you can do about. Just be in the game, be consistent as long as you are enjoying it. And there would be times when this wave will just take you to the next level. So I think that's pretty much what I have for the students to share.
Thanks, Samir, for sharing your journey. I mean, it's a classic case of falling and getting up again and having the perseverance to do it. Believing in what you do, trying it out, most importantly, trying it out at a small scale and learning the lessons, typical agile kind of a method, typical lean startup or whatever you call it, that iterative process. And I think it's one more undercurrent that you mentioned was you don't get the product market fit right on day one. You need to keep on trying it. I mean, that's an important thing, because most of the time in B schools, everybody talks about product market fit, and students get a wrong idea that they will have product market fit on day one. And when they don't get it, they are very disappointed. They come back to us saying, "Oh, sir, you talked about this and this is not happening in real time. What do I do?" Some people get dejected. So that's where incubators and people like Madam Poini, Madam come into the picture, who kind of have patience to deal with these people and tell them, "Baba, ho jayega, don't worry," and create that ecosystem. Yeah, thanks a lot. Yeah, let's go to Sohit. Yeah, over to Sohit. I'll just
sure. So thanks a lot for tying it all together. I have taken a slightly different approach. I want to talk about not only the briefcase journey, but a far larger impact that's being created right now, a far bigger change that the country is seeing. So with your permission, can I share a few slides? I just want
Sure. You are the host. You are a co-host, so you can do that. Yeah.
Great. Thanks everyone for your time. What I wanted to talk about, today was, as I said, a far bigger change that India is seeing. Yes, at Briefcase, we are a part of that change, and we'll cover that as we talk about our story. But I didn't want to miss this opportunity to kind of bring you all up to speed on what's happening in the healthcare front. Ma'am talked about a lot of examples of how life has become easy thanks to digitization. I wanted to start with actually using the examples she gave, but with a different twist. So I know she spoke about the innovative company in the end, but when she was talking about ease of living and how technology has improved the ease of living, I don't know how many of you noticed there was no example of healthcare. Let's go through some of the things she spoke about, or some of the things that are happening around us. How easy is it to get grocery delivered to home? How much time does it take? 10 minutes? You have multiple companies talking about that. But what happens when it comes to ambulances? Forget 10 minutes. Do you even get an ambulance at home when needed? Or what happens when you want to get it's easier to get a haircut done at home today than to get your blood pressure measured by a qualified technician or an injection administered. I'm sure we've all found our long lost friend on various social media channels. But when it comes to finding a blood donor, what's the process? How do you go about it? These are all real life situations that we've all been in. COVID has unfortunately brought some of this to the fore. Last example from my story, how easy is it to track your stock market portfolio? Multiple platforms give you multiple ways of doing it. But how do you track your father's diabetes, your mother's hypertension? It's still very, very challenging to do that. So, the fact remains that for a sector like healthcare, which is probably one of the most important aspects of your lives, the impact of digitization has been slow. It's a fact that we are all living in the country. It's largely true around the world as well. But India, especially, where innovation and startup ecosystem has so very well developed over the last few years, healthcare has been slow to catch up. But that's all changing now. And that's what I want to talk about. This is all thanks to a mission called the Ayushman Bharat Digital Mission, or is now also being called the Unified Health Interface, UHI. So just a brief background about ABDM. It was first spoken about by the Honorable Prime Minister in his Independence Day speech in 2020. It was then called the National Digital Health Mission, NDHM, where he spoke about creating a framework, a healthcare ecosystem, which is one, digital, two, interoperable, and I'll talk about interoperability a lot as we progress, and three, standardized. So what does this mean to you? It means that your healthcare information, it means that healthcare services can seamlessly move across the ecosystem. So some of the examples I gave you on earlier page can come to life thanks to the ABDM. A question that comes often when you talk about ABDM, and we tend to talk a lot about it, is hoga kaise? How will you do it? You know, the market is so fragmented. There are about 1.5 million doctors in the country, about 70 odd thousand hospitals who are affiliated to some or the other insurance network, and so many other healthcare providers. So how will you achieve all of this? This is where the government has taken an open public infrastructure approach, an open digital ecosystem approach. Now, have we heard that term before? Yes, Aadhaar KYC, Aadhaar eKYC, that is there. Your UPI. Some of you would be tracking recently, there was an account aggregator model, which kind of brings your lending history together. So these are all examples of open digital infra, public digital infra that is a India first phenomena. It's very unique to the country. It's not seen anywhere in the world. In fact, some of these are being exported to the world. ABDM forms the next part of that chapter. We also tend to call this the whole thing an India stack. The ABDM at a very basic level has 4 pillars. One is a registry for doctors and healthcare providers and facilities. So today, as I mentioned, there is no way for you to find verified information about doctors and facilities. This will form a pillar of ABDM, a single source of truth where you can look up information that you need at the right time and at the right place. The second pillar is adoption of EMRs. This is like the digital record management system by doctors and healthcare facilities. This is an area where a lot of work has been done and a lot more work needs to be done. Also an area where a lot of questions get asked. कि मेरा डॉक्टर तो अभी भी पेपर पेंसिल से लिखता है. You know, it's so difficult to change the behavior of a doctor. We try to break this down into multiple parts. If you look at, you know, your pile of health records at home, what are the key records you will see? A vast majority of those records are diagnostic reports. And hey, they are already digitized. When was the last time you saw a pathology lab report or a radiology report which was handwritten? For some of you, as young students, probably never. For some of us who are older, many, many years back or decades back. So there is some level of digitization that's already happened on that side. Your discharge summaries are digital. May not be codified medical terminology, but they are digital. So the work that needs to be done is on the front of the doctors and your indoor case papers. And that is where effort is being put in. But we are very, very optimistic that even those changes, and some of it has been thanks to COVID, are now coming through. And you will see this coming over the next couple of years, a lot more digitization that you will see. The third pillar of ABDM, which is very, very relevant to you and me as individuals, is creation of an Aadhaar address. What is an Aadhaar address? I will take you to the example of UPI. You will have a UPI handle. It could be something like Sohit @OKICICI, or something that you've created for yourself on your bank account. The Aadhaar address is exactly the same thing. You can create a health ID or an Aadhaar address which is unique to you. Whenever you go to a provider, you share that address with them. All the information that they generate for you gets tagged to that information. And then it is discoverable, or it is all possible to aggregate that information in one place. And that takes me to the fourth pillar of ABDM, which is this personal health record system. Till now, when I asked you about your medical information, you would proudly say it all lies in a cabinet at home. The X-rays and the MRIs go under the mattress. But how easy is it to A, find that information when needed and use it in a constructive or a meaningful manner? ABDM will allow you to do that. Have all your medical information in a digital format at one place, which then also can be built upon, not only in terms of referring to past reports, but seeing the health trends. So this is an open framework, as I said, that the government has created. But is it that the government is going to do everything and there is nothing left for others to do? The answer is no. And that is where I now again bring in the UPI example. ABDM or UHI is the UPI of healthcare. If you look at the diagrams we've shown here on the left and the right, you will see that there is a stark similarity between the two. So let me just kind of talk you through it. On the UPI framework, you have your various banks, who are the places, who are like the providers or sources of your money in case of a transactional journey. All these banks are linked to a UPI gateway, which is run by NPCI. But for you, what matters then are these UPI apps. Google Pay, Phone Pay, Paytm, they've become so commonplace now, so mainstream, that no longer do people say UPI karo. They just say Paytm karo or Google Pay. That's become, and Ma'am Bhatt also used the example that your sabzi wala tells you, hey, why don't you Google Pay me the money? This is your gateway into the UPI framework, these apps. What it has ensured is interoperability. I spoke about this word earlier. Interoperability means I have an account in SBI and Kaustubh has an account in ICICI. Neither of us needs to worry about where the account is, nor do we need to worry about the account details. All I need is a UPI handle. And thanks to these apps, that handle has become Kaustubh's mobile number. So all I do is just use his mobile number to transfer money to. Now let's go to healthcare. Exactly the same phenomena, just that the number of providers would be in another order of magnitude. So while if you have 200 banks linked to UPI framework today, you will have 70 odd thousand hospitals, 1.5 million doctors, and a few thousand labs that will plug into the UHI framework or the ABDM gateway. The gateway will be run by the National Health Authority to begin with, but all the innovation that is happening on top of it will be by private players. So the first of those innovations is like UPI apps, something called the personal health record apps. That is where I bring in the briefcase journey. In my introduction, Kaustubh mentioned that we were involved in the NDHM or the ABDM framework creation. So we actually helped design, as founders of Briefcase, the two of us helped design a part of the framework of ABDM. And now, as we speak, we are the first private PHR app to be integrated with ABDM. What that means is, going forward, you can use the Briefcase app to create your address, Abha address, to give consents. Because mind you, with private information like health information, your consent is extremely important. Again, taking the UPI example, can your money move from your account to mine without you consenting? The answer is no. That's the same thing that will happen here. Your information cannot move from a SRL to a Manipal hospital unless until you consent to it. And you use the PHR app to do it. Lastly, this will become an app or a platform where you can aggregate all your health information. So imagine now you've gone to SRL, to Metropolis, to Manipal, to Apollo, or to different doctors, all that information coming at one place. The analytics being done on that for your purpose, for you to be able to see how your health trends are working. So this is the big change that I started talking about. Healthcare is changing. It is changing for good, and it will have a massive impact on our lives. Here's a vision we have of how healthcare delivery will get revolutionized as you go forward. Let's take an example of Sohit. Sohit is not feeling well and goes to, let's say, Hinduja Hospital in Mumbai to see a doctor. The doctor creates a prescription for Sohit, which has two parts to it. Some medical tests to be done and certain medications to be taken. That prescription, the moment it is generated, reaches a PHR app like Briefcase or any other PHR app. And because thanks to the open UHI network, because as I mentioned, it's not only healthcare information, even healthcare services are being made interoperable. So once you have that prescription on your app, you can use the app to seamlessly reach out to your preferred lab partner. or a click of a few buttons, clicks, you can schedule your home sample collection. You can order medicine from there through your preferred players. It's all interoperable. It's not a closed system. It's an open architecture. And once the report is generated by your preferred partner, SRL, Metropolis, Thyrocare, Dr. Lal, you choose it. That report can be seamlessly shared back with the doctor, and you can have a follow-up consultation. And mind you, that consultation could be teleconsultation. So today, if you had to do teleconsultation, if the doctor is with Apollo, you need to be on Apollo app. If the doctor is with some other provider, you need to be on their app. UHI will open that up. And if I add the layer of insurance, all the bills generated from any of these players can be seamlessly shared with your insurance provider, and you can get an OPD insurance free. So ladies and gentlemen, I'd want you to take some time to just reflect on the healthcare journey we've been through in the past and the painful journey that we've been through due to COVID, and then imagine how that's going to change. That's the power of the ABDM and UPI. Bringing in the briefcase story in the middle of this. So, a lot of people ask us, what was the trigger of starting briefcase? As I mentioned, the healthcare journey in this country has been very painful on all counts, whether it is cost, access, and just the sheer inconvenience of it. Harsh and I, the two founders, we've had our own share of journeys, painful journeys. Fortunately for us, those happened around the same time, which got us thinking as to how you can improve this journey. And so in 2015, 2016, we actively started thinking about it and launched Briefcase in 2016, which was 6 years back. Samir spoke about the product market fit. Rohan spoke about how they started with some example and then other opportunities came about. We've taken our own share of time. It's been 5 years, 6 years, and a lot of questions being asked. Ki karna kya cha rahe ho? What are you trying to do before NDHM came about? And that was where the big opportunity came for us. Today, we can say that, as early movers in ABDM, and I'll again go back to the example Samir gave, it was difficult for him to compete with the print players who were selling it for 80 years. But with digital, it was easier because the game was new. With ABDM, the game is new. It's new for all the players, and we are as much an established or an incumbent party as providers who've been around for many, many years. So you see with ABDM, a lot is happening. We are trying to do our bit. So the government has already created the framework. Private innovators are creating their solutions. All your healthcare providers are at various stages of integrating. But there is one big missing piece. And that is my last message to you all here. What can you do to make this successful? Because unless and until the citizens of this country pick up ABDM or get linked to ABDM, it would not be successful. So it depends on all of us collectively to change our own lives for good. Just a few requests for you all as I sign off is to just read up more about ABDM. We have on our website, briefcase.com, a lot of information pertaining to that. Create your Aadhaar address. And there is a selfish motive for you to create that. And younger people may kind of identify more with it. When I created my email address on Gmail, this was about 15, 20 years back, I could happily get sohit.kapoor@gmail.com. Ask any person today whether they get the email address of their choice on Gmail, and the answer is no. The same thing will happen with your Aadhaar address. My Aadhaar address, ladies and gentlemen, is sohit@ndhm. I was one of the earlier guys to make it. I could get such a simple one. If you try to get it today, you may still be able to get the name of your choice, but later on, it will become tougher and tougher. And yes, it may seem like a fad today to have a nice sounding Aadhaar address, but imagine going forward where all your healthcare interactions require you to provide an address. A Sohit 10572 @NDHM will be very difficult to give and may lead to more complications. So do create your Aadhaar address today. Ask your friends to do that. And finally, ask your healthcare providers to join. So with that, I'll sign off now. But thanks a lot for your time, and super excited about the journey that all the startups, the innovators are taking in this country, and the change that we are seeing. Thank you.
Sohit, sorry, Sameer here. One question. So to create the Aadhaar address, I can just download the Briefcase app and do it.
Yes. So as I said, we are the first private player to integrate into ABDM. So we are now, you can create your Aadhaar address on the Briefcase app. I'd say by weekend, we should have that app live and running. We got the final approvals yesterday itself.
Good timing. Yeah.
Great timing. Wonderful. Yeah. Can you, yeah. I will just, wonderful. Sohit, thank you very much for, making it so simple and helping us understand through a simple analogy of something that we are used to, fintech. I mean, it's the same. So opportunities lie everywhere. How we take it, how we pick onto them is our skill. I mean, the way you talked about the ABDM health stack and the India health stack, so many opportunities there, but we just don't see them. Students are busy in the domain that they are in. Food order करना है तो चलो market बड़ा है, opportunity देखते हैं, but they don't look at a parallel opportunity using the same technology in another space where apparently the demand seems to be less, but it's a lot more value adding. It's a lot more futuristic. Thanks for that.
Yeah, Kaustubh, if we can make a point to that, it's again a personal journey for Harsh and me. We are neither medical professionals nor technologists. We were investment bankers who just kind of saw a need and just said we can try to create something. So message to the students is that, as Samir mentioned, there is definite value to having a skill set, and I would say problem solving is one of those skill sets. So sometimes it also becomes about, are you able to, and Rohan also alluded to it, are you able to see a problem and do you have a solution for that? So don't get bogged down by that. And this whole ecosystem is super democratic. It doesn't kind of box you into tight these things that you can do only this and not that. So it's a world for you to go out and explore.
Absolutely. I mean, with that, you answered Jatin Khurana's question: do MBA graduates with no engineering background have space in the innovation wave today or not? I think that question automatically gets answered.
My co-founder Harsh is a chartered accountant and an MBA.
And that beautifully ties up with how Poini ma'am started in the beginning of how platforms are democratizing opportunities, helping startups build on those basic innovations like the cell phone and the internet and things like that, and how the opportunities lie around, flying around everywhere. Just before kind of opening up to the questions, there are lots of questions. Can you see the questions in the chat window, all of you? Yeah, everybody.
Yes.
Yeah, right. All right. So just I mean, just to kind of summarize everybody's discussion, we have just about 5 minutes left. New tech platforms are democratizing a lot of things, so lots of opportunities around. Regulations coming in also bring about a lot of opportunities. So students look at, keep your eyes, ears open about what's happening in the regulatory ecosystem. So basic triggers, which I could kind of quickly capture, were maybe how to increase convenience, how to increase equitability, how to increase availability, how to increase reach, and of course, cut costs. So these are some triggers that I could kind of pick up from the four of them. Open to you for the questions. Who would want to kind of take those questions with, any more questions from the audience? Somebody has asked Sohit a very specific question. What is the monetization model for Briefcase?
Sure. No, a great question, something that we keep getting asked a lot. Our approach to, the whole model going forward is, if you create a platform which is serving a need for the user, it will create multiple opportunities for you to, make money. Some of the monetization models, let me quickly touch upon before we pass on to others, is, as I said, there is a platform which is sitting in the middle. where when the prescription comes, you can order, you can connect with your partners to, order medicines, to book lab tests. So there is a platform fees that can be, that can be generated out of that. And which could by itself, if you tie in the layer of OPD insurance or insurance, can become a meaningful model of monetization. The second piece is data monetization. And before people start kind of getting questions around how data monetization will happen, this is a very plain, simple data monetization for the user. As I said, today you have no way of being able to track your health history. But with a centralized platform, you will be able to not only see all your past health trends, but a meaningful analytics can be driven to also start predicting stuff for you. So if in my case, for example, my HbA1c over the last 5 years has gone from 5.4 to 5.9, still in the green range, but I would never notice it because it's such normal. Unless and until someone points it out to me that you are on a trend to become pre-diabetic soon if you don't watch out for it. So there are multiple places that you can tap into the user's healthcare journey with the user's consent, all in a privacy compliant manner, and create revenue models out of this. There are more models we have, which in a specific settings we can discuss those as well.
And that ties up beautifully with what Rohan mentioned, in that the mother and child space, multiple opportunities can be spotted, and revenue streams can be generated, provided you build the foundation first. Poini ma'am, one question for you, directly for you. In fact, all of you said that startups seem to be in a much better position to spot opportunities in the upcoming space, and it's been proven for a long time now. So what are the reasons why that happens? So I mean, I want you to inspire our students to get out of that mindset कि बाबा यार हमारे पास ना कोई resource नहीं है, कोई technology नहीं है, कोई नहीं है. So I would like to know from Poini ma'am first and then the others, of why do you feel startups are in a much better position to spot these opportunities and capitalize them?
I think there's no single answer to that, Kaustubh. Here is the case, basically, you have now too many basically precedents in startup going successful in varied segment, right? And one success could basically create an opportunity. So for example, we talk about I think one of the speakers talk about 10 minutes delivery. Now, grocery was have e-commerce is such a common thing, and there are so many Zepto comes and talks about 10 minutes delivery. To be very honest, it may be a question or debatable point. Do you really need 10 minutes delivery or not? But there is an opportunity to create a position about your startup and you get into it, right? So that's one thing. And there are so many precedents. There are throwing many basically, confidence to spot even like very niche opportunity out there. That's one thing. Second thing is that there are confidence, I would say. There were problems earlier, they are now. Earlier, perhaps confidence was not there because of lack of, mature ecosystem. Now you also see that basically, ecosystem where you see investors are willing to put in money, even in long gestation period kind of companies, very, very difficult. Space tech startup, they are getting funded. You don't know even what revenue and when it will come by, right? But they are getting funded. You see, government, it's one of the biggest champions these days when it comes to entrepreneurship. You see industry engaging with startup, most of the leading industry or corporates have their open innovation programs, right? So they are throwing basically their own problem statement, which becomes basically opportunity for. So I don't think there is a single answer to that. It's just that milieu, which is so conducive, and then startups and young entrepreneurs are becoming more mature at a very early stage. It is building. There is a confidence out there in execution, and there is a supportive ecosystem here.
And that kind of fits into what Mr. Ramanan talked about in his speech about the ecosystem coming up. Thanks, Poini ma'am. Any closing comments from anybody? Any of you, three of you?
So, just a follow-up point to what ma'am was saying. I think the reason where startups can see opportunity and large corporates sometimes find it difficult to do is I'd say lack of options. As startups, that is our, in the sense, that's our core focus. We've all grown up. If you look at our examples of startups and the 3 ones that ma'am spoke about, that was their reason for existence, that they saw an opportunity, grew into it. For large corporates, they've already found that space where they are making money. So very few organizations are actually able to build that culture internally. You can take an example of Google, for example, or Amazon, who've still gone out and created businesses in newer areas. The Google Pay came out of the Google architecture, but to replicate that culture is, according to me, a bit tougher. And Samir also mentioned that in large organizations, they become slow moving because there are so many processes, there are so many people to take along. Decision making becomes slow. If you asked any of the 3 of us, how many people does it take to take a decision, even the biggest decision, and it'll be hardly 2 or 3 people. Like we have to, let's say, change the way we talk about briefcase name. Change it. It'll take only Harsh and me to decide that. In a large organization, if I was to call it rebranding, that rebranding becomes a multi-month or a multi-quarter kind of project.
Yeah, thanks for that. Rohan, Samir, any closing comments? Either of you or anyone?
Yeah, I think Shobit actually rightly told that we as a startup, we don't have any option. We need to innovate. Otherwise, we will be nowhere into the market. And specifically, like in healthcare also, if you talk in our industry, because Shobit will understand, because he is interacting with those people. Those are big sharks. You are right now, the Shark Tank might came up, but those are big sharks into the market in healthcare. So in if you see in last 2 years, there are lots of innovation which is came up into our sector, which is healthcare. People might not know these things prior to COVID or the lockdown, because healthcare was always seen as not so very good industry, but it's having a very good opportunities, and those processes are, I can tell you, the processes are very outdated. So there are a lot of opportunities in technology companies in healthcare, and it is actually helping both the sides. Means the people who are the service providers and for the consumers. Actually, if you see, there is nothing there into the market. So I like to congratulate Shobhit for his work, what he started.
Wonderful.
Yeah.
Thank you so much,
Rohan. Samir, anything from your side? Last closing comments?
No, I think just go ahead and do it. There's nothing else to say there.
Yeah. Thanks everyone. And the message to students, trouble your career placement cell a little less. Do something on your own. I think that's what I would take from here. Thank you very much, all of you. Thank you, Poini ma'am. Thank you, Sohit. Thank you, Rohan. Thank you, Samir. And thank you, Professor Murthy and Dr. Vaishali Patil for organizing this event. Thanks a lot. Bye.
Yeah. Thanks, Kaustav.
Thank you so much.
It was a really great session. I'm getting a lot of the parallel chats from students, appreciating the proceedings, and I must immensely thank Poini Bhatt madam, Sohit and Samir and Rohan for their valuable inputs and taking time out for Wellinger, for our students and other audiences. Thank you very much, and let us move on to the next session. And I would now invite Mr. Hemant Balla to switch on your video Hemant Bala is from Higher India, and we want to place a special highlight here. Higher India is supporting B School conferences for last 3 years, and this is the third consecutive year they are sponsoring our conference, and we immensely thank Higher for supporting the academic cause. And Hemant Bala is here. He is Associate Director at Higher, looking after smart homes. And Bala is here actually to educate us about how Higher as a brand is creating value. How is it trying to outsmart their competitors? And something more that probably we do not know, but it is really good at Higher. Hemant, please take on.
Thank you so much, Mr. Murthy. It's very insightful, and I must thank you for this opportunity. And I must thank a few of the speakers who just preceded me. It was lovely listening to these stories. And as we all say, all brands are stories. So I'm here today representing Higher. I'll just share my screen. I hope I'm audible and visible, both.
Absolutely clear.
Great. So I'm here. I take care of smart homes as a category for Higher, and today I'm just here to talk about Higher and our story, and how I'll try to say it as interestingly as all the entrepreneurs have talked about their stories just before me. So our story actually, just like all stories, is a story which starts in 1984, to be precise, on 26th of December 1984. In a small place in China. This is a town which is called Xingtao, and Xingtao is actually spelled with a Q, but actually sounds like TS or CH. And for those who love beers, and I hope there are many, they would know that there's a beer in that name. And this beer dates back to 1880s. It's a Greek factory, a brewery, where it is made in Xingtao. And the town was famous only for this till 1984, till we actually came in and actually took that place from them. So in 1984, what happened is our founder, Mr. Zhang Rumen, came to this town and started up this company, which is called Higher today. It's actually not just a brand now, it's a brand of brands. From 84 to 1998, we were just following up, building a brand and doing some diversification in terms of our portfolio. We, as you all know, we are a major appliances brand. We deal in all refrigerators, washing machines, air conditioners, as many of us would know. So this brand actually had been in China till 1998, when we actually moved international and became a global brand from 2005 onwards. During this time, the entire focus was on building a brand and delivering quality to the consumers. After that, we actually started acquiring brands from across the globe. And right now, we are a brand of brands. When I say that, we have around about 6 more brands which we took up, from Kasate and Leader, which are a Chinese brand, to Aqua, which is a Japanese leader in its category, Fisher and Pickle, which is an Indonesian brand, and then GE's entire electric appliances business is completely owned by Higher now. And lately, we have also acquired Candy, if you have heard of. This is an Italian brand in the same major appliances segment, where we actually, which we actually acquired in 2019. This makes us actually to the list of 100 global brands across the globe. We are in the top 100 brands that operate. And this has been all thanks to continuous innovation and continuous technology and continuous strategy evolution, right from the initial phase of building a brand. Right now, we are actually, we have just moved ahead from there to becoming an ecosystem-based brand. So I'll talk more about what is an ecosystem brand, with the word which I've been quite hearing in a few earlier presentations also. But let me just talk about, give you a small bite from history. You see this picture. This picture is from 1985. And this talks about, this picture is actually taken from the Qingdao factory, wherein on one day, Mr. Rumen, the founder of the company, was actually on a tour to the warehouse. And he saw a few refrigerators which were actually not up to the mark, which were not as per the quality standards of Higher. Nothing doing, he actually segregated 76 refrigerators, which he found were not as per the quality standards which he wanted to deliver to the consumers. They were all segregated, brought in an open forum, in an open meeting for all employees of the factory, and he gave a sledgehammer to the same people who actually produced those refrigerators to just break them down, demolish them. And that is where the entire quality consciousness of the brand started. Right? So right from its imbibing, we knew that we are going to deliver only quality products. And that is what has been at the core of this brand. Right? And from there, that was in the phase when we were actually in a brand building stage. And that right from there, the brand actually started getting that traction. From there to an ever evolving, changing world, which is today, which we have been talking about, with technology taking up the entire space, where we see today, the future is actually now wherein we are seeing electric cars, we are seeing drones doing the deliveries, we are also seeing 5G connecting the entire world, or driverless cars based on the GPS, and China even making their own sun. The future is actually, we have already arrived in the future. There's a lot happening in this space where ecosystem has become very, very important, and the brands really need to look forward and operate in future, right in the present. So what we are doing for that bit is actually growing from just being a high-end product brand to becoming a brand, scenario brand, and an ecosystem brand. So let me explain, let me take a minute here and tell you that while a good lot of our competition is focusing on bringing products with high-end features, from giving them best of the finishes and just pricing them with their features, what we have been doing for past 3-5 years is actually moving into not the space of just selling products, but also selling ecosystem services. So I'll just talk about scenarios. Imagine currently, when we go back home, or when we actually start from the office, we go back home and we reach home, we open our lock, we get into a room, switch on the lights, switch on the AC for a comfortable temperature, switch on our music entertainment system, and then go to a refrigerator or the kitchen and find out something to eat. That's how the entire piece happens. And in this entire process, we touch upon our music systems, TVs, air conditioners, refrigerators, and all those microwaves. So all these products actually are what the products are from our major appliances. But what happens in a scenario-based brand is that all these products are not independent. They actually start talking to each other. And they don't act just by you reaching home or by your action. They all start to read your location. And as soon as you leave from office, the air conditioner knows that I am going to take 40 minutes to reach home, and the AC is going to take 30 minutes to actually set the temperature to my comfortable temperature. The AC can actually switch it on after exact 10 minutes and make sure that when I reach home, my AC gives me the temperature, a comfort. When I reach home, the comfortable temperature that I require. The music system switches on. The camera on my door reads my face and understands that this is the owner of the house who's actually home. And I don't need to actually put out my keys from my pocket, just opens up with mere touch or just by sensing me. And the refrigerator is able to understand that I would require something to eat and what all is there in the refrigerator, and it will pop up a recipe if I wish to make my dinner for that day. So that's what a scenario brand is, and that is the place where we have been working on. This is the space where we are operating right now. But the strategy has actually moved one step ahead into ecosystem. So while I was talking about the entire scenario piece, all these products were able to talk to each other. And all these products, if they are from the higher brand, they will be very easily communicating to each other. But in future, these products will not just be limiting to talking to each other. These products will actually be talking to the services which are outside. Right. So imagine a future wherein your refrigerator is able to understand that it doesn't have enough products or even enough ingredients for a recipe to be made. So it is and you would want to have that recipe in the evening. So it will be able to order from Amazon maybe or whatever service you link. Your washing machine is linked to your laundry services and to your clothing brands, and is able to take a few actions. Your TV is able to generate or give you content which you really like and pull out content from that. So if you really ask me, we have already started living this future if I tell you that we have already started building ecosystem wherein we have started generating revenues. So now where we are is we are not just a product brand. We are actually a brand which is not just earning by selling a refrigerator, but also earning by the ecosystem that we provide with it. Right. So that's where we are slowly going, and that brings me to just introduce you to the corporate with a video. I hope let me just share the sound.
Founded in 1984, Hire Group is a world-leading provider of solutions for a better life. Focusing on user experience and keeping abreast of the times, Hire has topped global major appliances brand rankings by Euromonitor International for 12 consecutive years. Its subsidiary, Hire Smart Home, is among the list of Fortune's Global 500. India, the world's second most populous country, is becoming a mainstream emerging market with rapid economic growth. Hire, keeping in mind the globalization concept of creating mainstream brands in mainstream markets, saw its first presence in India in 2004. Started as refrigerator factory with an area of only 36,000 square meters, Hire has gradually developed and established the Pune factory, Pune Industrial Park, and Noida Industrial Park. With continuous launch of new industrial park projects, its 3-in-1 localization strategy of R&D, manufacturing, and sales and marketing has become the most reliable stronghold in India market.
This is just a very brief peep into what we are and how this brand has been. Just to share with you, and we very happily share this piece, that Hire is continuously for last 13 years ranked as #1 brand, global major appliances brand. Right? This is a study done by Euromonitor, and for last 13 years continuously, right from 2009, we have been global #1, and not just in one category, but also #1 in major categories that we operate in, and I'll take you through with that. And one of the biggest portfolio, right from its beginning in India, we have continuously been introducing new categories of products. So Hire today has the biggest portfolio in this industry, from 9 different product categories that we operate in, and we are actually expanding a few categories in next coming months, from washing machines to refrigerators to water heaters to LED TVs. Anything and everything that you ask for in residential or commercial solutions is and built-in solutions now, which are being adopted by a good lot of builders. Everything that you ask for is available in this portfolio of products that we offer. All right. And we have just by having a large portfolio doesn't mean that we actually we become the leaders. It is actually the constant innovation that's happening in all these categories, right? From refrigerators, where from an age where we had top-mounted refrigerator, where the refrigerator had freezer on the tops and the entire refrigeration area at the bottom. We have moved from there and brought in new products like bottom-mounted refrigerators on the consumer's need, and continuously listened to the Indian consumer, tried to find out what is it that the consumer really wants, and bringing in products. So one of the major piece that has been is the innovation that we have brought in continuously in last 20 years of, or approximately 20 years of operation. I'm just giving you a small video on a few of the innovations that we've done and just sharing with you very proudly.
When local habits demanded 90% of the times usable fridge section at the top and 10% of the times usable freezer section at the bottom, Haier offered its iconic bottom-mounted refrigerator range, giving India its first Chukna Mat advantage and made life easier. Because we listened, we changed things. When there was a need for a convertible option in double-door refrigerators, we listened, we changed things. When Indian consumers demanded more style and designs on their refrigerators, Haier offered glass door finish, colors and patterns like no other. Because we listened, we changed things. When Haier offered its industry-first NZP technology-enabled washing machines in India that worked in near zero water pressure, we made life easier. Because we listened, we changed things. Haier presented its patented self-clean technology to Indian consumers, such that the AC cleans its own evaporator and washing machine cleans its own drum with no human effort. We made life easier. Because we listened, we changed things.
Haier, made in India, made for India.
Haier, made in India and made for India.
Haier, inspired living.
So in last few presentations, there was a very interesting question as to what makes startups take better and large organizations to fail. I still believe that at Haier, we are a very young organization who has been continuously innovating and listening very carefully to the consumer. One of the keys actually to continuously innovate is to listen to the consumer, find out the problem that exists, and bring a new solution to the same. Now we are not just producing these are not just innovations which have happened across the globe. These are innovations that many of these actually started happening in India, and we were the pioneers in bringing in bottom-mounted refrigerators, or to actually produce the first side-by-side convertible refrigerator in India. Right. So that's how it has been, and what makes us number one, not just as a complete brand, but also in few category in these categories. The first of which is actually the cooling category, which is our main business. We hold around about 21% of share of the global market, right, in refrigerators. And the plain and simple reason is innovation in the same. Apart from the fact that we offer a very strong, complete range of products, right from the old top-mounted refrigerators to the bottom-mounted refrigerators, side-by-side, 2 doors, 3 doors, French doors. We also have wine chillers and deep freezers, which we brought in as commercial solutions into the country. And now a good lot of residential consumers are also asking for deep freezers. Thanks to COVID, many people wanted to store a good lot of food stuff at home. So wine chillers and deep freezer have actually started getting their way into the residential space also. So we hold 21% there, and we have continuously been for last 13 years the leader in this category, which is the cooling products. The second category where we lead in is the laundry services, or the wash care, that is washing machines. So right from front loads to top loads to semi-automatics to fully automatics to dryers and the combos of the same, we have all that a customer asks for. And the interesting piece is that we zoomed from around about 8.5% to 16.5% in just 11 years or 10 years of our existence, of last 10 years, continuously being there for last 12 years on top in terms of the volumes, in terms of the brand recall, in terms of as a category to be, right? In air conditioners, we were the first movers into the connected air conditioner space. That means products which are smart, which actually get connected to Wi-Fi and which can be used through the mobile apps. So remotes are an old age game. Now the new in thing has been mobile phone, the one thing that can actually control everything. So we were the first brand to introduce it, and continuously for last 4 years we have been on top in terms of the sales. Though we have the complete range of products, apart from the same, we have commercial and residential solutions, tower ACs and split ACs, and all tonnages that are asked for by the consumers. In this category, we also innovated with a self-clean thing, because cleaning is very much required for the coil of the air conditioner. So we developed a technology which makes sure that the AC remains clean inside and gives better air all the time. Right? That makes us a leader in this category. We've sold over 100 million units of our water heaters, and now we have smart water heaters as a new addition to this category. We have instant water heaters and storage water heaters, both commercial and residential, and we have now smart water heaters, which you can, right from the comfort of your house, of your bed, when you're not willing to get out in a cold winter morning, can actually switch on your water heater and preset a temperature to make sure that it's ready for your bath when you actually wish to get out of your bed. So that has actually kept us, the innovation in this category has kept us on toes for a very long time, and we're very glad that we have a very global approach to this product, and we source this from 9 different factories across the world, and we also produce the same. Around about 85% of this product is actually made in India, right? We've last year introduced kitchen appliances, and we offer a complete range of built-in kitchen appliances, right from microwaves to ovens to hobs and hoods, with technology from across the globe, which has been taken right from a good lot of it actually comes from Fisher and Paykel in Italy. We also produce in US, and we also produce in China and Turkey and New Zealand also. So this product comes with a good lot of new age features, like very quiet performance in terms of the chimneys, which actually used to be very noisy. And these products are also can be controlled with your mobile phone. You can actually switch on and switch off the hood by just by a swipe on your mobile phone. So these are all smart. There are a good lot of smart products in this category, and we also wish to become a leader in this category in India in coming few years. With TV, it has been very interesting, though we were a late entrant into this space, but we have a very different take on TV as an industry. Sorry. So in this space, while a good lot of brands are only focusing on picture quality and adding only features to the product, which are about sound and picture quality, we actually went ahead to make sure that TV becomes the ecosystem center. So what we are doing is we actually developed an app for the televisions with which TV can control and keep you updated on what is happening in your kitchen, in your washroom, or in your bedroom, with an update on, if you imagine a scenario wherein a housewife is actually watching a movie and also wants to get an update on what is the status of cooking on the microwave, and also wants to get a status of what's happening in the bathroom on her washing machine. So now TV becomes the center of the house, wherein you can continue enjoying your movie, and it can also give you an update, not just mobile phone, but also on your TV. You can get an update on the complete wash cycle, as to what is the status of the wash cycle and what is the status of the recipe that you had kept for cooking inside your microwave. So that's the strategy that we have taken. We even though we compete very strongly with all the high definition and picture quality and high sound, good quality sound and all that stuff, but we also are integrating new age features to our TVs to make sure that they become the center of the house, and they hold the entire ecosystem together. So that's the route that we have taken. In 2019, we started introducing the smart products to India. Smart products are essentially the products that are connected to Wi-Fi and also operate with a mobile app. So all these products that we earlier used to have as single products, standalone products, are now connected products, and they can actually talk to each other And a mobile phone can control the temperature of your AC. It can also control the wash cycle. You can pause, resume, and change the wash cycle while the washing is going on. You can actually use your mobile phone to control the content, and you can actually play music of your choice right from your mobile phone, which will actually, or a movie of your choice, which will actually start reflecting onto your TV. And you can also control the side-by-side high-end refrigerator, which gives you all the information on what are ingredients inside the refrigerator, what is the recipe that can be made based on the ingredients available in the refrigerator. So these are all products that we have already introduced to India. We've sold around about 40,000 products in last year, 2021. And we now have the product sets already at display across the country, wherein all these products are shown as connected products inside the stores. The next step, which is supposed to actually come in 2024, and as I said, that future is now. So we've already started taking steps to create an ecosystem within India with services required by the Indian consumer, so that our products can actually connect to the services that are used by Indians, so that the products can actually order food through a refrigerator. The TV can actually connect to content which is very localized and very Indian and serve it to our consumers. So we are producing it, and we also have the entire cloud services which will back this entire piece up, and will send the entire big data is being worked upon, so that we can serve the consumer better and provide him services which are by now unimagined of. So in this step, what we did is we actually last year started up our first smart home, and it's a completely new take on how products are displayed inside the stores. By now, if you go to an appliance store, all that you see is a good lot of refrigerators stacked side by side. You would see a good lot of washing machines stacked there, and so forth, so on and so forth. So all the products are just stacked side by side. You hardly get to experience the products. We have built up our own first smart home, which is a smart experience center. I'll just give you a small video on the same. And this is in Delhi, Lajpat Nagar.
Alexa, turn on the lights.
So all the products that you see here, they have been set up in such a manner that when a consumer enters this store, he actually feels like he's entered his own flat, wherein the door opens with a sensor, just a touch of the finger, or with Wi-Fi. All the products are connected to Wi-Fi, and he can actually experience all these products by controlling them through a mobile phone, which is placed there. So we would very soon be opening another smart home in Mumbai also, and I would request, as soon as that happens, we'll let you know, for you all to actually experience the same in Mumbai, or whenever you come to Delhi. I would request you to please experience the same. Apart from doing this, in terms of opening a smart home, what we've done, we've actually developed a solution in India for campuses, wherein we have around about 200 plus sites wherein we have set up laundry solutions, smart laundry solutions for the students, wherein they can actually pay for every wash cycle. And we set up the washing machines in campuses, wherein students have direct access, and they share the same washing machine by just doing the payments on that bit. So around about 70 plus colleges in India have already adopted the smart laundry business. We call it Higher Smart Solutions. And we also now have shared AC services in more than 3 campuses, with around about 80 machines installed, in some places in hostels, and in some places we actually tried in hospitality also. This is the same thing. So this model is very unique to India, which has been developed in India and is now being deployed in Japan, Thailand, Pakistan, and a few other countries also. So this is the power of innovation, and how we actually take the product to the consumers, and how we can actually offer the services like laundry to a set of people who actually do not intend to buy a washing machine but still require laundry services. Without actually going to a commercial laundry, they can actually wash their clothes right in their campuses. This is done specifically for the students. So what all we do, there is a backbone to this, which is the entire manufacturing strength. In 2007, we actually set up our first factory in Pune. By 2015, we actually got the first Make in India award also, which was very prestigious and very big award for us to actually begin with. And then in last year, we have actually set up another factory in India, which is in Greater Noida, which is the North Industrial Park, which as we call it NIP, wherein we are now building refrigerators, washing machines, and air conditioners within India and selling for India for the consumers. And we also have the R&D completely being done in India for developing Indian products. This brings Haier to be one of the top recalled brands among top 5. So we are right now at number 3 with a very strong recall, around about matching what our major competitors have. This is we stand there, right? We are growing at a fast pace, at 27% CAGR for last 6 years, and this is around about 3 times that of the industry. And courtesy to all the innovation that's happening, courtesy to a very strong manufacturing and supply chain strength that we have, and a very strong network of R&D solutions that we operate, and a very, very strong channel that we have for sure, which is we are available on Amazon, Flipkart. We are available on all the modern trade, major modern trade and key retailers across India. And we have around about 23,000 plus counters where we sell these products across India, with 43 branches and now 2 factories and 31 plus warehouses across the country. So this is what has been the strength of the organization, that we are very young. We just launched in 2004. And right now we are among the top 5 most recalled brands in India. Hire offers a very strong R&D network. That is one major reason for the innovations continuously to be coming, and that is because we just don't operate one R&D center as one for the country. We actually operate on a 10+N kind of a open structure where all these 10 units are connected, and R&D for all the products happens in all 10 spaces continuously to bring in products which are not just built for that country, but are also successful products across the globe. So that is what makes us number one across, and we've continuously won awards, whether it is design awards or Red Dot awards or IDEA awards. So continuously we have a strong number of patents which happen every year. This is what has been the strength of the organization. And the vision for the brand is, if you see, it's not to become the product company. It is actually to become a service provider. In the internet age, we are actually striving to become a service provider for a better life experience across the globe. And if we talk about India, there's a very specific vision for India, that is to become the second largest appliance company by 2024, that is 2 years from now, and focus continuously on developing innovative products for the consumers, and to be known for excellence in its user experience. That is how we deliver value to the consumer, by bringing in new innovations. Right. This is my piece for today. That's what I wanted to say, and I'm thankful for this opportunity, Dr. Murthy, for giving a chance for Hire to share our story.
Yes, Mr. Hemant Balla, it was seriously a lot of learning. Though we exist along with you, we do not know these technologies exist. When you showed that the smart homes are really fantastic, unbelievable. The technology, how it has really entered our life, we actually got a different picture of your brand Hair. No, definitely we had a lot to learn about products and about your own brand, and the way you narrated it was superb, and probably the PPTs were so colorful and they were so attractive. It made us really engaged with your presentation, and thank you, Mr. Hemant Balla, and thank you Hair as a brand for being with us, and we look forward to have you on campus again on some nearest opportunity to interact with our students on a direct basis.
For sure, and I wish all the students all the best. There is a complete evolution happening around us. Technology is bringing a lot of opportunities, and a good lot of people have actually started leveraging that. And I completely go with what you were saying, that now students should take up that lead and start building on ecosystems and leverage this technology to bring new startups to India. Right. Thank you so much, everyone. Thank you.
Thank you, Mr. Hemant, and thank you. Now we are closing it for lunch and coming back at 2 o'clock for authors to make presentations. And kindly fill the feedback forms which are available on your portal. Thank you everyone.
Dear participants and the audience, we have a validity session at 4:15 sharp. You join on this link at 4:10. Thank you so much.